female ADHD looks like the female autism phenotype. For autistic women, we have less of that globular network and more of that brain networks work really well on their own. But then if you try to connect them, they aren't as connected. And so then if female autism look different to male autism, should we give it a different name? I was dismissed in my autism assessment 4 times, and the criteria that they used to assess me was very male-centered. The whole process took 7 to 8 months before I finally got a diagnosis.
Do you think that it is easier for women to get a diagnosis of ADHD than autism?
An inspiring voice in neurodiversity, Dr. Samantha Hiew
is a keynote speaker, lived experience researcher, and founder of ADHD Girls,
a platform reshaping how society understands and supports neurodivergent women.
Named a difference maker by PBS America, she has spoken to over 100,000 people, trained 80-plus FTSE companies,
and is the author of Tip of the ADHD Iceberg, a compassionate guide for late diagnosed neurodivergence.
70 to 80% of ADHD often co-occurs with autism, and if that individual has more than ADHD, then we're looking at a nervous system that needed regulation before it needs to be stimulated. And with the AuDHDers, we find that people don't often respond to.
In your research, your experience, what do you believe is at the root cause of ADHD?
I think that there's an evolutionary.
Welcome to the Dr. Brighten Show, where we burn the BS in women's health to the ground. I'm your host, Dr. Jolene Brighten, and if you've ever been dismissed, told your symptoms are normal or just in your head, or been told just to deal with it, this show is for you. And if while listening to this, you decide you like this kind of content, I invite you to head over to drbrighten.com, where you'll find free guides, twice weekly podcast releases, and a ton of resources to support you on your journey. Let's dive in. What is one myth about ADHD that must go away?
I think the fact that, ADHD is just focus, attention, executive dysfunction. So much of the myth around how we're too sensitive, how we're so emotionally dysregulated, that has to go. Because seeing ADHD as something as a symptom rather than a process, or a system, the whole body system experience, is what we need to look at.
All right, let's step back and reframe that then, because I live in the United States, right? That's where we operate. It's very capitalistic, right? It's all about work, production, drive. Moms, you better be able to do it all. You got to be a super mom. And so the executive dysfunction is what gets felt and highlighted. But what you're saying is that there's a whole body system experience. Can you explain that more?
So one of the reasons why I came to this conclusion was because I took a deep dive into ADHD when I wrote my book, Tip of the ADHD Iceberg. When I did that, I realized that because my background was in genetics in my undergraduate years, and seeing that actually there were genes we inherited from our parents that predisposes us to increased sensitivity to the world. And this didn't just impact our brain development, it also impacted all our body systems. And in fact, some of what they call the hot genes, they were expressed in up to 54 different tissue types. Mm-hmm. And because of that, I looked into understanding our physical conditions and then realizing that actually ADHD very much differs from AuDHD, which I later had an autism diagnosis and realized why ADHD medication itself didn't work for me. Mm-hmm. I needed so much more support, which is whole body support that includes nervous system regulation, understanding the neurodivergence through a trauma-informed perspective, mm-hmm. And so much more. The physical health, social, emotional, there's a whole bunch of systems that are at play here.
Yeah. So I want to talk about that medication not working. So we see there's a couple of common experiences for women. One being cyclically, it doesn't work. The second being in perimenopause and menopause, medication no longer working, not doing the same. But then there are people that it just doesn't work for at all. And I always wonder, is there a co-occurring autism diagnosis that has been missed?
Yeah, so we know that ADHD often co-occurs with autism, and it can be up to 70 to 80%, in some people. And the medication that they prescribe prescribed for ADHD, really targets the dopaminergic norepinephrine pathway. And that in itself can spike the dopamine and norepinephrine levels. And if that individual has more than ADHD, then we're looking at a nervous system that needed regulation before it needs to be stimulated. Because there is so much that is already kind of influx within us, that needed to be balanced fast before we bring in the stimulants. And often with the ADHDers, we find that people don't often respond to high levels of stimulants, or if they do, then there is a certain dysregulation that's happening in their body. And some people might find that it worked for a little while and then it stopped working, and then they have to go back to the drawing board, go back to the psychiatrist, and they ask for perhaps non-stimulants or lower levels of stimulants as they try to then regulate through like adding maybe hormonal replacement therapies, especially when we are at the perimenopausal age or any kind of really big hormonal transitions that's happening in our body, as you know.
Yeah. Yeah. Well, and for people listening, norepinephrine is a stress hormone. And it's so interesting because these stress hormones, we call things stress hormones, reproductive hormones, yet we have receptors throughout our brain. And these stress hormones act like neurotransmitters within the brain. I mean, the brain has all of these receptors for hormones that are docking in there and influencing us. And so if you have a dysregulated nervous system, you already have, and most neurodivergent people have this baseline of dysregulation, of extra stress, And so you already have this dysregulation of your stress hormones. What you're saying is adding that medication on is just really gasoline to a fire that's already burning out of control.
Yeah, especially when stimulant medication actually increases stress in our body, as we know. And the ADHD might respond to that more positively. But that also depends on their nervous system, because if they've had a traumatic history, then that can also cause some symptoms that mimic, trauma dysregulation. When, the medications kind of taper off. Then with AuDHD, we are looking at much more than dopamine and norepinephrine. We're looking at GABA, glutamate, serotonin. So when we spike that level of norepinephrine and dopamine, we are, adding gasoline to fire. That also depends on where they are, because our biology is so in flux that sometimes we actually need the medication, but at other times it might go so high that we struggle to bring it back down. And that's when we may feel more of that like heart palpitation, like just kind of like on edge, because those neurotransmitters, you're right, they are part of that stress hormones, what they call the catecholamine. I can never pronounce that word. And so when that goes up, then it can take time to clear. We have different biology as well, right? With our neurodivergent experience. And that's where you start to see the diversity in our experience, because those who, we have, like, say they found maybe up to 79 different gene variants for ADHD, that can cause something that manifests as ADHD. And part of this is how fast can you clear, and how fast can you make this dopamine, and norepinephrine, and how fast can you clear them? And if you don't clear them fast enough, then your body could be at a state of like being quite hyper, for potentially something like 1 or 2 or 3 days, before it goes back down. And if your life context surrounds, maybe, taking things that you are used to taking, like coffee or other things that we use as coping mechanism before we were diagnosed or started the medication, and then we add them on, then that's where you start to see people maybe having mysterious side effects to medication that they are unaware of. And this isn't communicated then to your prescribing clinician during the appointments. Then they're often left wondering, oh, we don't know here. So people are shooting in the dark in terms of giving someone a medication and not knowing what's going to happen. And in many cases, it can help, but we need to understand what we're dealing with.
Well, it's interesting because we can do genetic testing. So people are often like, will ask me like, well, have you tried medication? There's this idea that if you have a condition and you don't personally use the medication, you must be anti that medication. And so people will make that assumption about me and stimulants. But I know genetically speaking, I do not clear catecholamines. So I have that warrior gene. They go up, they don't leave for days. Yes. Yeah, the COMT, which is really interesting. I'm starting to dive into the research more around, because what's really interesting is that we see that COMT, the COMT gene, so you don't clear catecholamines as well, but you also don't clear your estrogen as well. And so we see that COMT gene, I'm spelling it out for people so that I'm hoping the transcript actually reads it out so people can understand what I'm saying. But what we see is that's a really common gene among ADHD people. And when I was going through the research and I found that, I was like, well, man, like I knew I had this gene like 10 years ago. Like that would have been a clue of what was going on. But it was for the reason of having that gene. I should explain to people. So this means that why we call it the warrior gene is that, I read Romantasy and I just finished up a big war in Zodiac Academy. And I'm like, whoa, that would have been me. I would have been out there fighting for hours because my catecholamines would have been up and they wouldn't have stopped. And it's so interesting because I think a lot of times people view this as like, oh, you've got a genetic defect, something's wrong with you. And it's yet we were the ones who would have fought for the tribe until the threat was completely extinguished and would have like been out there doing all that. But in a modern world, when I get affected with stress, my catecholamines are not going to clear. It's going to affect me so much more. And I've done salivary testing. I've done urine testing to track, like, how is my cortisol? I'm such a nerd. So
I love it. This is everything I do.
And like, I went through a stressful situation of something really traumatic of losing a dog. And I was like, I want to track my catecholamines through this. And I did not clear those. They stayed up. And I tested my husband at the same time because I'm like, we're both having this experience. And his are like, totally normal. Like he had a spike initially, goes down to baseline, but mine persisted.
I love that. I love that, Jolene, because what you just explained, you humanize our experience. Because so many of our experience is internal and people don't see it. And when you act or react a certain way to a situation, it is often biological. There is a source, right? Mm-hmm. And you know what it is. And you can then mitigate, by maybe altering your lifestyle or, knowing that if stimulants don't work for you, maybe, you try another means. But as for me, I went down to quite a low dose because I realized at a high dose, I was just like on fire, And one thing I'm curious about is that the COMT, you talk about the warrior. Do you have a slow COMT or like a fast COMT?
It's like slow clearance.
Yeah. So that's what either the warrior or the worrier, right?
Oh, warrior or the worrier. Is that in your book?
I didn't write about that, but I probably should have. But I talk about it in my talks. Yeah. Because so if you have too much of it at any one time, it can also make you worry, with the hypervigilance. But yeah, you're right. The warrior definitely is in there, but there's so much at play. And that is actually one of the gene variant that is expressed in up to 54 different tissue types. And it's in your ovaries, in your pancreas, and like everything. So it is, it has a massive impact.
Yeah. And you talked about other genetics that make you more sensitive to the environment. And I often think in the framework of women, like we're already programmed to be more sensitive to the environment, right? Because we have to create life, gestate life, then feed that life with our body, and the environment has to be safe. But I'm curious, from that genetic perspective with ADHD women, what have you found in your research?
So there are a lot of different genes, like the MAOA, that's one that actually they say contributes to either, aggression or lack of. And there are just like dopaminergic genes like DRD, and also there's another one that is responsible for serotonin clearance and can cause rejection sensitivity. And I also realized that actually after deep diving into genetics, it is not just the gene variant, it's how we're methylated, how they are methylated as well. And that can determine whether the protein that gene makes, actually functions in a biochemical pathway. And if it isn't methylated, kind of typically, then we can lose that ability to, say another, like some of the gene variants that are involved in energy production and toxin clearance. All of this, like they are involved in systemic, pathways in our body. And the pathways that give us energy, also is a big one. And MTHFR, this is something that we talked about so much that some people don't even believe that it is a thing.
Yeah.
And we supplement for it. I mean, we need like methylated form of this supplement. What is it? B9. And you know what it is.
Methylfolate.
Yeah.
It is B9. You are correct.
Yeah. So if we take the usual folate, that won't really work. If you have that mutation. But then I also realized that I had, and correct my biochemistry through the supplementation route, and still that wasn't enough. Then I looked at the hormones, and I was kind of doing what you did, testing myself, but also testing other people around me. Like all my kids have been tested, partners, ex-partners, just to see what I'm dealing
and
with.
genes were bad. So ex-partner, your hormones, no.
Yes, I mean, sometimes you just have to see that if you're a good match. And then I had to really accept that it was time to start hormonal replacement therapy, because I didn't really want to for ages and ages, but then it became so jarring that actually you could be so much better with it, because it was such a huge difference between me in my high estrogen phase and then me like luteal phase, and that is not just me. I've done collective lived experience research, and I love that some women have said that when they enter luteal phase, they get into that existential crisis.
Yeah.
And they started saying that, oh God, what's I'm doing with my life? And am I in the right place? And then when that passed, they're like, I'm fine. And so when I did start my HRT, it was life-changing.
You started HRT being in perimenopause?
Yeah, only last year.
Okay.
In November.
Yeah, because often
December.
women, why I want to clarify is because I will get women that are in their 20s and they're like, can I just take estrogen during my luteal phase? Like, can I just take that? Then I don't have to deal with, this progesterone coming in. I'm like, no, I'm sorry, it doesn't work that way. And if we gave you estrogen and your estrogen's too high in that phase, you're probably going to have a histamine issue. And then we might be dealing with PMDD because of that, or rage issues, or feeling just like you have the flu all the time. It's a horrible feeling.
Yeah.
So I just wanted to clarify that. I think people, it was actually interesting. I spoke at a conference in the UK that was several years ago. And I was on a panel, and a woman asked about HRT, and she was like, certainly you must be against this. And I was like, oh no, when it's my time, sign me up. And people were surprised because they're like, you've been prescribing, I explained that I've been prescribing HRT for when I was an intern still, I have been prescribing HRT for over a dozen years now. And someone said, well, what? But you tell people using the pill, you wouldn't use the pill for these things. So I don't understand. And it made me realize there's so much misinformation about hormones. And so when we're talking about hormone replacement therapy, we're not talking about the pill. We're talking about a topical estrogen, which is a much lower dose, lower risk of clots. And it's just the lowest amount to give you the most benefit.
And bioidentical.
Yes.
That was the bit that I probably didn't realize before I started HRT, because I somehow had bought into the stigma, but then I started reading Dr. Lisa Mosconi book, and she
I
did
love
loads
Lisa.
Yeah.
I've endorsed her books. Everybody, they're great
Really?
books.
Awesome.
Yeah.
So I love that she's done brain scans, and really checked the different, what's going on in our brain, the pre-menopausal, peri, and then post, and see that actually we have significantly lower brain energy, in perimenopause.
Yeah.
And she talked about body identical hormones, and also she disbanded, all the myths about breast cancer linkage.
Don't use horse urine, people. Premarin's out. And progestins.
Yes.
A lot of the medical community and the scientific community are like progesterone, progestins, same thing. Not the same thing. You want bioidentical progesterone, which is protective. And now as the breast cancer research is coming out, progestin is looking really ugly.
Yeah, but then that's in all the Mirena coil, isn't it? And then the hormonal contraceptives. But also there is another layer that I have to deal with, which is having a slow COMT. It means that I can't really introduce too much estrogen at any one time, too quickly. So I've been going, what they say, start low and go slow.
Yeah.
And that has been my experience. And on the days when I forget to take my progesterone, I'm getting like palpitation the next day, which is actually what happened today. Yesterday, I forgot to do it, like when I went to bed. And so I knew today I'm going to need to just like tune in and kind of like regulate, you know, because like when you have a nervous system that's always in flux because of that biological changes that's happening, it's almost like, okay, you're tuning in to attune to yourself, not to like give yourself pressure, you know, I must not feel like this. But it's like, if that is what you're feeling, like accept it and try to learn to like regulate yourself. It might not be the most perfect, you know, strategy, but at least you're kinder to yourself as well when you know.
Yeah. Yeah. And it's important you talked about the methylated B vitamins as well. We know those are very important for estrogen clearance to the body. I have episodes about estrogen, and I will link to those if you guys want to deep dive more on it. But I'm curious, has anyone checked your testosterone as well? Because I often see that being an issue. ADHD, AuDHD, and autism women, their testosterone gets forgotten and they have dysregulation, lack of motivation. They wake up, they're not ready for the day. They're super groggy. They're crying all the time. They don't know why. It's almost like, you know, I feel like we have, it's like testosterone's our little shield sometimes to be like, not everything penetrates the surface.
So I'm glad you asked this because no one asked me. I went to the hormonal clinic, and even though it was a private clinic where I was paying through my nose, I still had to bring the knowledge. You know, no one talked about testosterone, you know, until I raised that question, and I got it tested, and they tested just testosterone and estrogen, and it is on the low side, you know, and they have always known it's on the low side. I brought my records, and they didn't say anything about it. I think because people are quite cautious, you know, perhaps there isn't enough research on AuDHD women, what, you know, testosterone does, and also knowing that, you know, in PCOS, we already have high androgen levels, then maybe there needs to be caution, you know, but as far as I know, I don't think I have PCOS, but what I do have is POTS and postural orthostatic tachycardia syndrome. And I think that's it. So then I have that, you know, kind of nervous system, this regulation that can happen because of anything. Like if I don't sleep well, then the next day it's like, you know, I almost feel like there is a bit of a tidal wave inside me. And I don't know whether that's the day where I'm going to be able to switch on or not. And you talked about histamine as well, because high estrogen can overactivate histamine. And then does testosterone help balance that? I don't know.
Testosterone does help with modulating the immune system, but in terms of like research specific on women, testosterone and histamine, I have yet to see anything substantial on that. But it's not because this isn't real. I think that's the important thing for people to understand. Everything women are experiencing is real. We just don't have funding to actually get it researched. I mean, we look on the United States, it's about $2 per endometriosis person. That's the allocation of research every single year. And yet when it comes to male pattern baldness, erectile dysfunction, like if a man, like, you know, can't feel like a man and doesn't feel sexy, like we pour all the money and research to it. What blows my mind is how often men will comment to me when I bring this up and say, well, then women need to be doing their own research. Why are they complaining? I'm like, then stop taxing us. Stop taking our money from men's health and then telling us just to deal with it.
Yeah. And also the fact that health research is, you know, largely governed by people who are perhaps don't really have ovaries, you know, and that's also due to the female, you know, kind of generational burden of being caregivers and you know that there are lesser female academics than there are male academics. But then about the histamine thing, I think, is it the balance between estrogen and progesterone that helps also?
Yes. So that helps immensely. And this is why I'm craving more research, because every neurodivergent woman is an N of one, because we actually don't know. We haven't studied it. And so some women, you'll give them oral progesterone. They feel so much better. They're so calm. So we talked about GABA before. Chill, baby. Be calm. Like everything's good. It's like whispering sweet nothings to you. But in other neurodivergent women, something is off in that system. And we don't understand why it is that when progesterone gets metabolized to allopregnanolone, it sets off like this cascade. So I actually just shared on my social media. So following my miscarriage, I ovulated. I felt so good the day before ovulation. The day of ovulation, I passed it and it was like a dark cloud moved in. And I have a past history of PMDD. And I was like, oh God, I know this feeling so well. And so, the question is like, okay, do I go now in a couple of days and get my progesterone tested and see, is it that my progesterone's optimal, too high, too low, like what's happening? And I was just like, I don't have time for that or feeling like this. So I was like, we are going to do some saffron. We're going to do some citicoline. We're going to hit omega-3s. We're going to start Claritin. Like I'm going to do the things that I know work for PMDD patients. And it's worked. It's working, which is good. But I'm like, women shouldn't have to go through life being like, let me just experiment here and there. We should have data to say, okay, here's how we know what will work for you.
Yeah, I love that. Like, I feel like, just speaking to you, and then you clearly have a medical qualification, but like so many other women in the neurodiverse community, we've been going around looking for strategies for like centuries. And I did like this lived experience research, on neurodivergent women, and I love the answers they came back with.
Yes,
All sorts. Like, they were like, kind of adaptogens, and we know that for a fact that we needed something like that because we have a biology that is in flux, and the saffron thing has been talked about, loads of supplements. Another one was actually being single. That was funny.
Like seriously though, like for anyone who has PMDD, for sure, anyone in perimenopause, even if you're not neurodivergent, being in a cohabitating with a partner is really hard. And something that I had posted, like if you feel like, every 2 weeks, 2 weeks out of every month, you feel like you want to leave your partner, check into PMDD. Maybe your partner sucks. That's real. But maybe check into PMDD. But it's the same thing that I see happens in perimenopause. So we see perimenopause, menopause, there's a lot of women initiating divorce. People are like, oh, it's just because women are having midlife crisis. I'm like, no. Women are losing their capacity for executive function, for lending their brain to another partner. They're sick of caretaking, and they're realizing that there's all these unmet needs, and this person is never going to step up and meet those needs because they've just seen them as a commodity, as a means to an end to fulfill the life they want. And that's a horrible place for someone to be.
Yeah. And also, this is something that I personally had been going through, the last few years since my diagnosis, and I have delivered talks on this, and I can look at the science and try to understand why we, get to later in life. Like, I don't even know if 40s are later in life, but to me, I still feel like a little kid. But apparently we're midlife and we have this midlife crisis, but it's not that simple, because we looked into the brain, scans of ADHD, like autistic women and AuDHD, right? And there was new research that came out in Dr. Gina Rippen's book on the lost girls of autism. And she found that the brain of autistic women, we are like more socially wired to connect, and also like heavily socially camouflage, to adapt to what people need from us. And that, takes time for it to kind of differentiate or discern between, is this autonomous or is this not? And when we were younger, we had more of that sex hormones, right? That floods our brain and maybe serve as a filter for people's behaviors, and we may take more kind of shit. I was trying to find a better word for it. And
it's true, it's facts.
Right, very factual. And then when you get to your 40s or late 30s or 40s, or if you have surgically induced menopause, or your body decides to go into menopause early, then those sex hormones start to plummet. And which we do experience every month anyway. But when you get to a certain age, you just don't have as much of it than younger women. And those sex hormones served as a filter. The filter is no longer there. Then you start to wonder, why did I do this for? Like, do I count here? What about me?
Yeah.
And I feel like we're in the season of truth. And that truth will be revealed in many ways. First, through our biology, but secondly, through the way we relate to one another. And also, if we are still willing to be the emotional caretaker in that relationship, which many people don't want to be when they get to a certain age. They want to live for themselves.
Yeah, I agree with that. You used the word camouflaging. A lot of people use the word masking as just to cover that, but camouflaging is what the research says, and really at the crux of the behavior that we're participating in, and masking falls within that term of camouflaging. Can you explain camouflaging if this is the first time someone's hearing it?
Yeah, so camouflaging is like the next level of what is masking, but it's totally different in that you're adapting a behavior that you think is accepted. And it could be a neurotypical behavior, and often is, because we scan our environment to see what is, the expected or accepted norm here. And then we take on a totally different persona that eventually becomes us. And then I've given talks to the community where women start to kind of wonder, who am I? 20 years after, they first got, not even diagnosed with ADHD or autism, just diagnosed with depression. And then being given SSRIs, being able to function in that relationship or in work. And then 20 years later, then start to wonder, who am I underneath all this? There is a sense of self that is quite diffused. And I see it in the community right now, collectively looking for answers, and then having been misdiagnosed, not just with depression, anxiety, but also borderline personality disorder, several different mood disorders, as though that is our fault. When we have this baseline that we go into the world, with different ways of relating to people and regulating and also adapting different personas, and then find that actually doesn't work either. Because, then actually our truth really wants to come out. And that's when people start to leave, their relationships if they weren't aligned. But yeah, camouflaging is something that is very real. And I love that, later in life when people start to want to be more of themselves, it can look very clunky. When we're starting to I'm going to be me now, and I'm going to just suddenly get the outburst of with being authentic. And then it will look so drastic and shocking to the person who's so used to you being just you, forever.
Yeah, it's true. So you talked about the camouflaging piece and then the misdiagnosis, but sometimes co-occurring diagnosis of mental health conditions, with autism, ADHD, AuDHD, so anxiety, bipolar disorder, depression. Why do you think medicine and even society as a whole is much more willing to diagnose a woman with a mental health disorder than to recognize that she has a different nervous system operating different from a neurotypical?
I guess because the research was done on a certain population that isn't inclusive of us. And also part of the research isn't wrong. Part of the research is that, there are genetic variants that contribute to what will look like bipolar and also schizophrenia. But the mood disorders, there is an innate physical sensitivity, but then a lot of these personality disorders have a root in relational injury, where we have sustained trauma from a young age, and then trying to have relationships with people. And when we encounter triggers, those behaviors aren't always voluntary. Most of the time they are primal, and it's reactive. And so I started looking into, what does AuDHD look like before trauma? And then what does it look like after trauma? And we're looking at, someone's capacity to love, and it is highly different. Because with trauma, you add that highly hypervigilant, thing that you look into every thing, every cue, as if it's a sign that they're gonna leave. I've done something. Oh my God, I'm gonna be left alone, and stuff like that. And also because of our innate way of being, right? Being autistic or autistic ADHD or even ADHD, where we can feel overwhelmed quite quickly. And then with autism and AuDHD, there is that sensory sensitivity. So from very early in life, you're going into social situations and those cues are too much, because they've done research and showed that the autistic brain actually was a highly male research, and they said that the emotions and the sensory, and the cognitive part of our brain is kind of the same. So we process feelings and thoughts as like our senses. They all feed into the same place. Whereas for autistic women, that we have less of that globular, network and more of that individual network where like all the brain networks work really well on their own. But then if you try to connect them, they aren't as connected. And that's in female autism. And so then if you feel that sensory challenge, it can be very heightened in your brain, but it can also be very contained. So often women try to contain that, because it isn't socially accepted. And then they then have meltdowns on their own or shutdowns on their own. Or, if that becomes so overwhelming that you can't control it, like with AuDHD, then you kind of, blah, Yeah, so it's a very interesting discovery.
Yeah. Well, that is interesting. And also in the context of what you said earlier of autistic women wanting to have more connection and wanting to be more social, which often isn't the way that autism is perceived. It's perceived as, somebody who can't communicate, who can't actually connect with others. And we find that that's just simply not true.
Yeah, because the face of autism, right, is what used to be the Rain Man and Sheldon. People in Asia don't even think, don't even hope to have a representation. People from different cultures also, that doesn't look like that. And so when you look at female autism, because we are so socially wired to connect, even if we may prefer to have our own space, and, even if we do have sensory challenges, we often mitigate that by, compensating by being more social, and perhaps more communicative, more literal. We basically have been invisible for so long.
Yeah.
Because we didn't know what to look like and at. And there was a new article in New Scientist that says, if female autism looked different to male autism, should we give it a different name? And yeah, it was interesting because we can, but how then are we going to acknowledge that it is a thing? And maybe we are going to move towards understanding neurodivergence as a very natural way of being.
Yeah.
And the thing is, when you talk about this, then people who, fall on the kind of the stronger spectrum of ASD, then they will feel underrepresented. So, I've had conversations with my colleagues, other speakers who say they work in the mental health clinics and the neurodivergence specialist clinics, if that exists, but they see those with more severe support needs, they may not be represented by all the conversations that we have now. So where does that leave us?
Yeah.
As a collective? Because I think, what is the implication on this rise in diagnosis on us as a society?
Yeah, I think, when people say that, okay, there's male autism, there's female autism, should we give them different names? I often think about heart attacks. Heart attacks, men have them, women have them, but women present differently. Women's experiences differently, but it's still a heart attack, at the baseline of it. And it almost feels like this idea that we have to call it something different to actually get clinicians to recognize that it's different. And I think you're right. We've seen a huge uptick this year in the United States with the talk of autism and them saying, well, we've got high support needs. It's funny because I've seen doctors say there's high support needs and then there's no support needs. And I'm like, no. To get the diagnosis of autism, there has to be some level of support you need. And it's interesting because I'll have people say to me, why did you need the diagnosis? Obviously, you've been fine your whole life. I'm like, so what you've seen appears fine. But it's funny because I look back at things even 10 years ago, I would say to my friends, when I'm in a conference and I take a stage, I speak, I give it my all, I meet with everybody, I will stand there for hours and I will meet with every single person who traveled to come see me. Then I will go back to my hotel room. I will bury myself in blankets, cover everything up, put in earplugs, and sometimes have a good cry. And I would say that to my colleagues, and they're just like, that's interesting. And nobody ever clocked it as like, oh, you allow yourself to the point of getting dysregulated. By the way, I actually don't mind that. For anyone listening, please always come up and say hi to me. I love that. I would never be where I'm at in this world if it wasn't for people who support me. But it's like, I have to go back into my cocoon and dissipate some of that energy, recalibrate. But I explain to people often of like, the childcare that I have, the executive assistant I have, like all the people I have support. I mean, as a female entrepreneur, that's seen as you're so successful. You've built a team. You're so smart. And I'm like, and what you don't understand is that I couldn't function without this team. And I had to build a life of support systems because society said, and I've had people argue, like, you're probably more moderate needs with how much support that you've gotten. And I'm like, what does it actually matter? Because what society has said is that you graduated, you have a doctorate, you have a license, you're able to function. So therefore, we're not going to give you the support you need. You look fine on the surface.
Yeah. And I love everything you said, Jolene, because I resonate with that so much. People think you don't need support, but the hidden struggles that you have, and I call them hidden because when you appear on stage, people see the part of you that actually loves to do what you do. So that is not a show. That is you authentically channeling, your love of like knowledge and helping people through it. That is so important to you, almost like oxygen, and you need that part, to be you. But then in order to keep that going and also be everything that society expects a woman to be, we need incredible amount of support, but people don't see that. And because if you had to do the work that you do and care for children and, cook for them and, look after your schedule, it's nearly impossible. And the meltdown that people tend to have, behind closed doors, they are real as well. But will we show that? We may talk about that. And I've actually openly had a meltdown on stage because it's like, no, I can't actually control this.
What a meltdown is, because I see all the time people on social media label it as a tantrum, and I'm like, a meltdown is not a tantrum. Can you explain it?
So often, the meltdown is a result of a nervous system overload, and it happens. It's what appears to be so quickly, even to you, because all the stages, that you kind of take on these cues from the environment that is both external and internal, by the way, and your body's trying to deal with this like signals that are breathing, over like the lid. And eventually when you feel like, okay, well, it's coming like a tidal wave. And that can look like sudden outbursts, like crying, for no reason, what appeared to be no reason. But by the time a meltdown happens, it's already too late. Your senses, your feelings, your thoughts have already like been overwhelmed. And they can come from as simple as, if you turn up on stage, like I've had situations where I turn up in a room where I have to give a talk and the light is really bright, like white, and it's too hot and the mic has echoes. And it's like a whiplash, that's happening. And people don't see that, but that is going to contribute to your tank being totally full and then overbrimming. And so, that's how I see meltdown, because it often happens so quickly and without us being able to explain it. And with AuDHDers, we have a nervous system dysregulation called dysautonomia, where often we don't know how to explain how we're feeling in that moment, but it takes time to kind of then say it.
Yeah. And, I think a lot of people can always relate to a panic attack, like they've seen a panic attack. It's been in the media enough to understand that a panic attack is completely out of someone's control. With a meltdown, there is no sense of fear or dread, but it is the same sympathetic overdrive. The nervous system gets overwhelmed, and it is a full speed ahead train that's already left the station and it has no brakes. And the only thing you have to do is wait for enough, for in the physics perspective, the train is going to have to meet enough friction to slow down, but it still has to run its course. And that's much like a meltdown. And I'll see people being very judgmental of people having meltdowns and being like, why can't you just hold it together? Why can't you just? And it's because the nervous system can't. And It's even the like, well, what are you feeling? More questions. What do you need? How can I help you? That also just contributes to things. And, I see this in my children when they have a meltdown and it's like, okay, just brace for impact because there is just nothing that can be done in this moment. We just have to be a safe space for them and make sure they're safe as their nervous system works this out.
Yeah, completely. It's like, I love that you did say, like, when people ask you what you need, like, I don't want conversation right now. Like, I can't talk, and I actually really can't, like, tell you because that is another demand.
Yeah.
I just want to be left alone, like, under a duvet, maybe with a salt lamp next to me, and just not talk to anyone.
Yeah.
Yeah.
Yeah. So I want to ask you, what did it look like for you? You talked about how people stepped into their more authentic self. Like they realized like, oh, here I am. I'm this, this different person. I think a lot about, I don't know if you've ever seen the movie I Heart Huckabees.
No, I'm not. I want to watch it now.
Okay. So there's a part where basically an existential crisis sets in and he's like, how am I not myself? How am I not myself? How am I not myself? And I feel like that is something, I remember watching that movie, I was probably in like my 20s and asking myself that question and being like, wait, who am I actually? And having this moment of feeling like I'm not always showing up as my authentic self and I'm going along with things and saying I'm interested in things and doing things that I actually am not. It still took like a while for me to work through that, but I feel like that's true for a lot of people as they start to question, how am I not myself? What did it look like for you stepping into your authentic self?
Such a complex question, very, very complex situation. Because I'm thinking, my authenticity isn't always like, I'm just saying like my natural state isn't fully inauthentic. But then being authentic to me means that actually, if I don't feel right about something, I'm going to say it. Mm-hmm. And if I'm around people who make me feel uncomfortable, then I will have to assert boundaries. And this is not something that I've ever been able to do very well, mm-hmm. And it starts from saying no when it is something that I don't feel is aligned to me right now, and saying no louder because I have what is essentially a utility wound where I need to feel useful in order to be accepted and loved. And in fact, after writing my whole book, in order to support the neurodiverse community and pouring my brain, what it looked like when I read it again, was I imposing my brain into the world, And it was like, if I was able to rationalize this and understand the process, then I can help me and everyone. But then that in itself meant that, am I not allowed to just be me without being useful? And that was a huge realization for me that I have been trapped in my head for as long as I can remember.
I so relate to this.
Yeah. And I didn't know how to feel. Mm-hmm. Like I thought I could, but it was so outward. I felt what everyone else felt, and I knew how to help them because that was how I was useful as a child. And then it transferred into every relationship that I had, if I could be of value. And in fact, one of the things I used to say to my ex-partner was that I can be of really high value to you. As if that was a really good reason for him to stay, which it was. It turned out to be the reason he stayed because he needed me, not because he wanted me. And that was a really painful realization when eventually I knew that because I was like that and he loved that, but he didn't love the whole of me, and that I couldn't be myself, the full, kind of authentic, messy reality of me in that relationship. Something in me was really breaking to come out. And that looked like anger or suppression. And because it wasn't expressed, it came out as a fire. It wasn't directed at him. It was directed as how I would regulate, which was sighing. I was like, essentially having a meltdown. And that was when he left. And I was just like, wow, okay. And that was when I had no choice but to feel. And for that whole month, I had to sit in a bath to regulate my nervous system every day. And I've never felt a grief that was so deep and so complete, because that abandonment wound mixed with the utility wound wasn't just from me. It was from my mother. I saw her as a martyr for 5 children. She had modeled to me what love looked like. And I was so angry that I then did that. And I was angry at the fact that I was always the provider, never provided. And when I asked people to step up to help me, it didn't always look nice. It didn't. I couldn't ask nicely because I didn't believe that I deserve it. And so, so that took such a big journey for me. In order to fully understand that actually, this is who I am, and I'm going to work on actually maybe not even being useful to people and just being truly me and actually start living for me. And this year I did that. I lived for me, and, I poured my energy into what gives me energy, which is community impact. And the event that I set up in April, which is probably the time when your community told you about me, was when I was trying to recover from the pain of that heartbreak. And I turned up, with my voice shaking, not actually feeling confident at all. I was feeling so beaten down and didn't really believe that I even deserved to be there. I've never hit so low in my life. And then from then on, I just got up and realized that actually I had to have that experience to understand that I could never outsource love. I could never outsource emotional safety, because in the end, I was forced to be my own emotional anchor.
Yeah.
And that was so hard. But I had really amazing people around me, friends who were going through similar things, and we understood each other and the community. We lived parallel lives. And then it was interesting because we all had this unspoken thing inside us. And when we gather in a safe space, it was the first time I felt like if I was going to tell you this story, it wasn't a performance, because like so many corporate structures expect you to go there and share your story, but then you speak and you kind of go into the space and the silence. But in the community, it's so felt, women who have had those experiences, who went through similar things, but at different timelines. And if you're at this timeline where you had to deal with this, emotional authenticity, then perhaps then there is so much love and value in being together in a safe space. And that's what I poured my energy into this year, even though perhaps it's not the one that makes the most financial sense. But I know that for me, I need to really lead from my heart. And if I do that, I'll always be okay. So that's authenticity for you.
Yeah, no, that's beautiful. Thank you for sharing that. And I think, what I want to highlight about that is that often when people think about camouflaging or masking, they think about deception. You're trying to just fit in. You're trying to be the right person so that you get into the group. And what they don't realize is that you're often self-sacrificing your own needs to show up and meet the needs of others. And, so much of what you said is, I've never heard the term utility wound before. It's definitely something that I'm like, oh gosh, there's another layer to work on for myself. You mentioned utility wound, you mentioned abandonment wound. What other kinds of wounds do you see that women are dealing with in your community?
Yeah, the too much wound.
Oh my God, is that not the truth? I'm actually working on the book, and I really think the dedication is going to be to like every woman who's been told she's too much.
I believe that women hold so much power, but we have perhaps silence that life force that is within us. And that's why sometimes I feel like now in my journey now, like I kind of cross over from being a scientist to a bit of a shaman. And I feel like because our stories isn't just in our body, like physically, but then the nervous system imprint that we have is from generations before us. And we've had so many oppression throughout history, right? If you think of even, the times when women used to be like burned on the stakes for telling the truth or actually wanting more aliveness, that is frowned upon. And then, the fact that we've had like no health research that was based on us, and then women's empowerment. I run a company called ADHD Girls, and not a single day passes by where a man doesn't tell me, what about us? Right. And I'm like, yeah. You're important.
I just want to say, I actually made a video because, and I put this on social media because I get asked that all the time. what about me? Like, what about men? What about talking about men's health? What about, and they have this need. And what it makes me angry is I see all these men who do not have expertise in women's health, yet they are asserting themselves as experts in women's health, inserting themselves into our story because it's such an easy profit for them. And I watch women who go to them because a man is finally validating their experience, and it's so refreshing and it's so amazing. And so you see them like blowing up on social media, and I don't think these are necessarily bad men. That's not what I'm saying. It's that they're following a capitalistic route, and women are a means to an end rather than looking at their own community. Like, you and I as women are fighting to get our information out there and to support women. And I see these men and I'm like, there are men who are fighting with us to give them information. Like, you could be serving them. Like, there's such a need in men's health community as well. And I've interviewed a couple of male practitioners just to put them out there, because women would say, I need someone for my husband to follow. I'm like, these are the people that are doing that. But it's so sad to me that men need support, but there's some kind of barrier happening right now where like there's not other men standing up to give them that support.
Yeah, it's interesting that you say that. Yeah, I mean, I certainly resonate with that. There are so many, of these conversations that I've had, and actually, I even try to bend to suit it. Like in my early days of neurodiversity, and I think that's why I started talking about neurodiversity instead of female neurodivergence, because people are asking me, to be more inclusive, and I find it even funnier when I'm first asked to go and talk about neurodivergence in women, and then they change it halfway and say, oh, there are a lot of men in the audience. And I have actually been in a room in an insurance company where I was talking about ovulation and the hormonal cycle, and the men were fixated.
Yeah. So
they wanted to know.
Same. I have spoken at, so there's been several like health corporations that have hired me, and they come in and speak, and it's the men with the most questions about women. And so it's something that I'm always like, my lane is women's health, and I will speak to, how as a man you can support women, but I'm not going to speak to what your experience is. I think that's the thing that definitely rubs me wrong, is when men are like, oh, you're a neurodivergent woman, or you're a woman on your period, or you're a woman with perimenopause. This is how you feel. And I'm like, you do not know. You do not know how I feel. I always love when they're like talking about like moms and being like, oh yeah, as a new mom, this is how you must be feeling. And I'm like, ask. It's such a novel thing. Ask us how we're feeling.
I really love this. And I think like actually in the future, I want to start talking more about relationships. And that's because we have men who are very interested in women's health, and that's because it affects them. Women are everywhere in our ecosystem. In order for them to thrive, they need to have good relationships with us. And the thing is, we all have different wounds. We go into relationships with that need to be useful, do not leave me. And then the man comes into a relationship with, I need to control this. If it's not controllable, I need to withdraw. If I can't withdraw, then I'm going to feel trapped. And I've seen this again and again and again in every relationship. And so it happens that in neurodivergent relationships, the autistic ADHD pairing is so common and can be painful if we don't understand what we're dealing with. When people can feel that maybe the man in the relationship can feel like the female partner is too intense during some times of the month. And then the female partner feels like they don't feel accepted, and they have to kind of suppress a bit of that fire. And eventually that fire comes out anyway. And it then looks like abuse or narcissistic empath pairing. But the truth is, we all have different kind of, archetypes at different times. And it is that, what is unspoken, in the vacuum, that is the issue here, in our relationship.
Yeah. Why is it so common, that ADHD autistic pairing in a couple?
Yeah, I love that. I think one of your questions was around like ADHD and how AuDHD arise. And I have done like a bit of deep dive into this because it's mainly from the ADHD perspective. And they have a study that looked at the evolutionary biology of ADHD. And they say that the risky alleles, the gene variants that contribute to ADHD, whether it's that sensation, novelty seeking, and the things that lead people to demise, is gradually being phased out in the population. And
because you expire before your time, before you can breed.
Right? Yeah. And maybe you would self-medicate to demise.
Yeah.
And then the authors in that paper actually postulated perhaps it's because they mated with autism, and then I kind of helped me visualize that somewhere up the evolutionary lineage, ADHD met autism and thought, you have the structure and routine that I need, and you have the adventure that gets me out of that, feel. And whether it's men or women in different, kind of archetype, I don't know. But eventually, we then had this mating take place that, eventually gave rise to AuDHD, which now we know is an entirely different brain dynamics and brain structure. And it is completely different to pure autism or pure ADHD, and that's why we have AuDHD as something completely different, and we have to treat it differently, and eventually accept it as a way of being.
I want to talk about the difference in the AuDHD brain, but I'm curious. So you, AuDHD girl, who do you partner with? Have you seen a pattern of the men you're attracted to?
I tend to go for the safe ones, or what look to be safe ones, because the safe ones, I have a pattern of going for nice guys. Mm-hmm. And boy, that's a mistake because...
What? Tell me more.
That's a mistake.
I'm I wish this was tea.
I thought, this person really kind, very nice. But then we're living in a time where people who were nice also had their different wounds.
Mm-hmm.
They didn't really feel safe to express themselves. And within that, there's a lot of inauthenticity going on.
Yeah.
And what I value so much is authenticity, and seeing what I, experience in private, and then what I see, how people act in public. And then there's a dissonance, and I don't like that. So it kind of make me feel like, do I trust you?
Autism cannot handle dissonance. I cannot handle a contradiction. My brain feels like it's itching if I see a contradiction. I don't know if you're the same way.
Completely.
Yeah.
Yes.
It'll drive me insane. And I'll think about it for years to come. The contradiction that I witnessed.
Yeah. And a lot of my work is to actually kind of match what is inside and outside as well. I'm still in a process, But yeah, to the partners that I tend to get attracted to are the ones who I feel are a safe place. Mm-hmm. But then they also happen to be quite controlling because there's a reason why they're safe or stable, because they're quite rigid.
Yeah. That
rigidity isn't something that I can take. I need freedom in the relationship as well as safe, which is a lot to ask, but that's why I'm single.
Yeah. Well, it's you met my husband briefly, and why I asked is because ADHD, AuDHD, we are that pairing, and it is for sure that the man can't plan a trip to save his life and have everything packed in the list and everything, and that is what I thrive on. We went to Iceland, and he was talking about oh my God, we would have never survived it if you hadn't done all the research and made sure that you had everything, you had lists and you had everything organized. And it's so interesting though, but he's more risk adverse, and I am more the risk taker. I was actually explaining to my child, we were listening to music. He's 12. He's and we were talking about a mosh pit, and he's oh, who would ever go in there? And I was me? Hi. I used to live in the mosh pit at concerts. And he's what? And then my husband's explaining, your mom used to bungee jump off bridges. It was totally not safe. She used to do all of this wild stuff. And he's oh, what happened? You're not this person anymore. I'm I take risks in different ways now, but I have small humans who depend on me, and that stops me. But it's just interesting that you say that, because I'm there is this dynamic of we have our strengths and our weaknesses within our relationship that we figured out. And it is because of being neurodivergent. It's you could never do this. And yet my biggest thing is I hate driving. This is where I relate to young Sheldon is statistically speaking, if you're going to die, it's going to be in the car. I don't like this at all. And he's I love driving. Driving's my my favorite. And so, I think it's really interesting how you find those pairings without ever knowing that you're actually neurodivergent and coming together. And I don't think it's too much to be like, I need freedom and I need safety. You're like, is that too much? That's too much to ask. I don't think so at all.
Yeah, I guess like it goes back to actually just being the person that you truly are, right at the beginning, and for me, I, was quite trapped in my head, and I don't think I was really like aligned internally and externally. So for me, then I attracted a partner that only liked a certain side, and then that was really difficult, towards the end. But now, I have my eyes wide open, and hopefully, with better results in the future. But I'm pretty content right now.
Good.
Yeah.
Well, I want to ask you. So we are often masking, and we don't always do that around the people we trust, right?
Mm-hmm.
Like our partners, our family. We want them to be our safe space, and we let our masks down. But that sometimes results in the partner or the other person misinterpreting your emotions as being mad or aggressive, these terms that people put on us, but also sometimes resentful because they're like, you show up and you do all of this for other people. Why can't you keep that up with me? How can women approach a relationship when that's the dynamic?
Yeah, it's interesting. I think that's why we have to go in straight away first day. Well, like it's
so
different now.
Diagnosed.
So many of us are like, I totally get it. So like you need to really have that go back to the drawing board mentality where you're like, actually, I know that there's a role that is set here and there's an expectation of what you want from me. But I don't think in this stage that I'm at now, where I'm discovering who I really am, that I can give that to you, not when I'm in low energy phase anyway.
Yeah.
And are you going to be okay with that? And that's such an honest conversation, right? Because then sometimes, even if you're okay with that theoretically, when it actually happens, when you're actually in a relationship and all the messy triggers start flying all over the place, life happens, then, your automatic response is going to happen. Then can you heal together? Or do you need some time apart in order to heal, on your own before coming back? So that's the tricky phase, I suppose, because for me, I actually held on for very, very many years before I eventually, told my ex-husband that I can't do it anymore. And I think in this new phase of my life that I know that I can no longer suppress myself or my voice or my emotions. So whoever I'm going to meet will have to be okay with that. And that person will have to be able to match my fire, which is because it's not always going to be there. Like I met somebody who said to me that the reason that, you can just have this outburst of rage is because you've had to put a lid on your emotions for a long time. But if you are able to practice like actually releasing yourself on a more regular basis, then you won't get to the point of, overflow. And that is so true.
Yeah.
So true.
What are some of the ways that you find are helpful for you to release those emotions?
Oh, I love movement at the moment and voice activation. I was saying to you, I went to that Temazcal ceremony. That's like Mexican. We went to a heated lodge. It was like hot in there. It was like a sauna and a steam room. And I thought, my neurodivergent self's going to die in here.
We don't thermoregulate well. This is true.
Well, that's what I thought. And as soon as you closed the door, I was like, oh my God, it's dark. I'm going to die. It was panic attack. And then I thought, okay, apparently the principle is that your body knows what to do. And then it did. In that lodge, I lasted 2 hours and I couldn't even go into the sauna for like 10 minutes. It's a lot warmer in the sauna, but that was kind of like a milder experience. So yeah, I found that movement and voice was for me. And that was very much mapped to my own unique needs. For other people, it may be nature walks, but what I have found is that we, whether it's men or women, have had our voice suppressed. So many neurodivergent men feel like, they aren't able to just really express their authentic self. And then the archetypes of what is accepted, the spiritual bypass, which I see everywhere. And
Explain what that is for people who don't know.
so that is another thing that I have done too, by intellectualizing our experience, by not feeling it, by going to yoga to release the stress without fully dealing with the why. It was a time where it's almost like you're going in to look for protection. And when you keep, the spiritual activities to protect yourself, you never really deal with the wounds underneath. And you're bypassing your actual growth by looking for these band-aids. It's not always easy because I said with our sensory sensitivities and our coping mechanisms over decades of our lifetimes, actually just being more stress averse and actually leaving something, withdraw, dissociate when something intense is happening, is not easy to say, go back into your body. It's more about attuning to what we need. And it's like really tapping into that internal wisdom. So for me, like somatics, being able to shake it out in my body, being able to dance and move and to sing and chant. I couldn't stop singing since I got to Mexico. I don't know why. There's something in this land that's making me like, just want to talk.
Singing and eating. This is the way it is here.
Yes. And families are so connected. I love that element, which in the West is not so much like that. I moved from Asia to England, and people are quite disconnected from their families. Like children leave home at the age of 16 or 17 to go up a year out. And to me, like for a neurodivergent child, like their brains are like 14. Like how can you go into the world like that? And then we make those choices from a very young age, and then it's not surprising that there is a rise in diagnosis now in the West, whilst people in other parts of the world wondering, what does ADHD look like in people like me? Like from Southeast Asia, I've given talks to APAC companies. They're like, why isn't there a single Asian person in the neurodiversity, groups? That's because your culture don't see your challenges as something that needs to be fixed. Maybe they see it as something that you need to tolerate or, suck it up or do something about it through other ways. There's so much stigma involved.
Yeah, it is interesting. The other thing about other cultures, so as you're talking about Mexican culture, like it's not the norm for every child just to go to college. They usually live at home. We see this in other cultures as well, where children live at home and they attend university. So they still have their safe place, their place to process, like they have their support. We see other cultures with multi-generational households. In the West, in the United States, in the UK, where you're from, we don't see that. We see a very fractured family unit. And I wonder if that is an environmental stressor that exacerbates the operating system of a neurodivergent individual, that makes it more pronounced. But also, the fact that it is that way means you have to be autonomous as quickly as possible. And when you're neurodivergent, as you said, like, there's the 30% rule, right? Like our brains are essentially like 3 years younger. Maybe that's why we still feel like kids. I don't know. I'm in my 40s too. And I'm like, I don't feel like I'm in my 40s. Like, and I still act like a child in some ways. But it is something that I think that kind of pressure is on neurodivergent individuals of like, grow up faster. Like, in the United States, you're asking 5-year-olds, what do you want to be when you grow up? My 12-year-old is still like, I have no idea. I'm like, that's a fantastic place to be in life. What a fantastic place to be, because that means you still are exploring all potential out there.
Yeah, 100%. So when we are put into a culture, and actually that is my experience because I'm a cross-cultural woman. I have lived half of my life in Asia where that generational household very much exists. And then another half of my life being smacked in the middle of a very cold city in Leeds when I first got there. And then London, having yeah, suppose without any family like support, throughout every single phases of my life that happened after that, which was, getting married, getting pregnant, having a baby, and, dealing with like that decade of existential crisis. And now, and I see really jarring, very different way of being that is not supported by the community element. Because one of the principle that they were addressing in that Temescal Lodge was fear. And I remember just walking along the street and thinking, but it's a different type of fear for you guys here in Mexico, because you have family and you live under one household. There is interconnectedness, there is interreliance, but in the West, in the UK or in the States, we are very much living on that, the Maslow's hierarchy of needs. It's very much about autonomy, fulfilling a potential, and leaving like the household early on to go and find your growth and your place in the world. But then with neurodivergent children, they're going in very early in life with that expectation from the world, yet being under-equipped to deal with that. From a very young age, I think I found a paper that looked at the development of mental health challenges, beginning from like 0 to 5 to 6 to 12 and 18, is that different parts of our brain are developing, at different times. And then the amygdala, the limbic system, I actually know it's with ADHD, it's the motor control, so that's why children with ADHD will get diagnosed if they're like, feeling all over the place, hyperactive. And then that's the amygdala, the limbic system starts to come online, and we get like children with ADHD, especially girls, can be diagnosed with anxiety, I think from the age of 11 to 12. And then the dopaminergic seeking, part of the brain comes online before the prefrontal cortex, that tells you that this is not a good idea, like what are you going to do with it, like in a year's time or 10 years time, that doesn't come online. So we're looking at a nervous system that is, that is going to have, that sees too much. And being under-equipped to deal with that, we have that fear and anxiety system, wrapped up very early on. And so there is that higher proportion of what constitute as post-traumatic stress disorder, and ADHD is like probably 3 or 5 times more likely to get that. And people with PTSD are 2 times more likely to be ADHD. So yeah, that is a very difficult place to be. So when you then hit transitions in your life where, now I got to deal with this again, what do I do? And your brain will go back to the time when you had to deal with something alone without any help, whether it's at 6 or 7 years old where you are being left to cry, or something happened to you and no one did anything about that. Or maybe you left home and went to university. That might have been the first time you've experienced like, what do I do here? Yeah. People do not know. And then that fear system, is the fear response is high and you're in survival mode. And so then what do you do? Then you almost can't blame people who go into spiritual bypass, because then I'm safe here. Yeah. And that's why I find community is the answer, to being more connected, and because if you come from a fearful place, if you make every decision like that, then you're going to attract the wrong people, the wrong opportunities into your life. But if you come from a place of purpose and authentic, and whilst feeling like you're not alone, then you're more likely to be able to make decisions that really align with you and healthier for you, I find.
Yeah. So speaking of trauma, your book, Tip of the ADHD Iceberg, you said you mostly wanted to find out if Gabor Mate was right to go on about trauma as the main cause for all the pain in our lives. So what did you discover?
So the reason I said that is because so many neurodivergents were messaging me after they attended like a talk about mental health and trauma and how Gabor Mate talked about. Sorry, Gabor Mate, like if you're listening, I'm sure, what you say is right for you. But trauma is certainly something that could be our constant companion. But then because, you also said that there's not a single gene that causes ADHD. Yes, there are 79 gene variants and counting, and that experience of ADHD isn't just focus or attention. It is an entire systemic, experience. And so when you say that, okay, what we experience is the pain, and that is also true, but then before that, we were born with that increased sensitivity to the world, and that was passed on by our parents. Yes, a lot of it could be epigenetics, that we kind of acquired in the womb. But a lot of that also, you can prove through looking at the genes that weren't methylated, that were just regular genes, they're hanging out, and they were still there, they were inherited. And so that's why I said that he wasn't totally right to put it all down to trauma, but then it can also, it shouldn't be discounted out of the story, but that it is a condition that will affect your entire way of being. And it affects people, even people who have said that they had no traumatic experiences, from childhood. So I feel like we tend to oversimplify the story, and then it kind of, I had a bit of that like realization when I was on a little psychedelic trip. Am I allowed to say it here?
You can Dr. Sarah Gottfried, who very much was talking all about her MDMA experience as part of her processing trauma. And a lot of people are using ketamine or ayahuasca.
For mental health.
Exactly. Well, it's interesting because gosh, was that like 2018 maybe? The Institute of Functional Medicine had an entire conference dedicated to essentially psychedelics and all the research coming out of Stanford and all of the research being done. Because they were like, patients are very much going to be interested in this, so we need to be well equipped to navigate it.
Yeah, exactly. And in Australia, they've legalized it and they're doing lots of clinical trials. But then for me, I had a supervised, psychedelics experience with my friend who actually does clinical trials, and she gave me a kind of moderate dose. It's not microdosing of psilocybin, and probably at a time when I was looking to go deeper, but probably wrongly timed because I was actually going through a traumatic experience. But what it did show me was that when that moment when I felt like my sense of self was being dissolved, they say like when you start the psychedelic experience, then your default mode network can disintegrate in that process. And in that time, like I just didn't, like the person who overthought what people thought about me, who think like, okay, I'm not good enough, that person left. Mm-hmm. And then I was thinking, why is everyone so serious? Why is Gabor Mate turning the world into, like looking at our traumas and nothing else? And that was when I was like, someone needs to say something about this. And that's when I thought, why are we so serious? Why can't we just play more? And I feel like that was when I really, truly understood who I was as a child before the world imposed all the pain onto me, by being so hypersensitive to everything. And I love that essence. And I try to remember it. Sometimes it's a bit hazy, but sometimes I remember what it felt like to be so carefree, as a child. And I want to be more like that. But also I wanted to add a caveat here that if we are predisposed to something like bipolar or schizophrenia, which many neurodivergents are, then like they don't naturally recommend psychedelics as an experience. Yeah. Because it does, regulate.
And I would also caveat that you should not do any kind of mind-altering treatments unless you're under the care of an experienced clinician who will also help you integrate afterwards. Because I've definitely seen people who thought, I just need to deal with, whatever I'm dealing with by having this psychedelic experience, and they come out of it in a far worse state because the person who was administering it didn't understand mental health, didn't understand reintegration, and there was no container and support as they rolled out of that. And then they were just left to deal with, I think sometimes, people will be like, you need to just deal with your trauma and get to the root of that. But you don't always have the capacity for that. And sometimes your body has blocked things out and buried them down because you have to heal. And this is something that I always say to patients of like, healing the physical body is the easy part. And once we get you to a state where like your hormones are much better and your body, your gut is functioning better and all of that, then all of the emotional stuff you haven't dealt with, that's going to be the final body, the physical body healed. Now the emotional body you actually have to work on. And that is the part where people don't usually want to go there. They're like, my gut is good. I am fine.
It's very, very true. And that's for some people, it's a good reason. And I love that you say that actually, because I did read in a book. Is it Dan Siegel's book about patterns of personality development? Where he said like some people are just like with the predisposition to mental health conditions, they may not need to feel everything in their body, like the traumatic experience, but maybe it's enough for them to just understand, because then, you can then move into a clean slate, because feeling so much pain in the body isn't that advice, especially if it kickstarts your stress response, and I should like say that we do with what we can deal with. And, for some people, they just prefer to do it in their timeline and we cannot rush the process.
So when it comes to trauma, this is one contributor to the experience of an ADHD individual. But in your research, your experience, what do you believe is at the root cause of ADHD?
So as you mentioned, all the different layers, right? I think that there's an evolutionary layer to begin with, that we have inherited this gene variants that causes cellular changes in our body. And it was so interesting when I looked into ADHD, it was affecting things like glucose metabolism, hormonal, clearance, energy production, insulin, there is so much to it. And also like immune system, like cytokines production. But with autism also, it's like it affects the structure that holds the cell together. And that structure is an mTOR pathway. And without that, it can cause like cancer, and like many neurodivergents are like probably more at risk of cancer because of that. And then the stress response. So that's the biological layer, right? But then ADHD is a psychology, emotional, and relational survival story. I think like if we want to put ADHD on a piece of paper, then okay, we're gonna be able to list all these traits and symptoms. But it is happening in real life to people. How do you support a person like holistically? Then you look at, not just that focus or regulation of their emotions, but also nervous system, emotions, and how to then have relationships with people. And that's why I think like with ADHD, that's the cause, but then also what we're going to do with it.
Yeah, it's so interesting how you talk about those differences there. I've come across the same research. I mean, dysregulated is the word that I have for the ADHD, AuDHD, autism experience. We've got nervous system dysregulation, we've got immune system dysregulation, we've got metabolic dysregulation, and we've got hormonal dysregulation. Like it's all taking place. And for so long, research and medicine has separated our hormones from our brain function. Now, I must say that, like, certainly I see like the generation, before me of gynecologists who are like, don't reduce women to just their hormones and don't say their hormones affect their brain because then we'll be seen as the lesser and we won't be able to advance. And I get how that was part of the narrative, but I think that it really did set us back in a way that they didn't intend, but they absolutely did influence. And with that, to understand, you referenced Dr. Lisa Mosconi's research of like estrogen and energy metabolism in the brain. The ADHD brain already has like half a battery supply. It already has such a hard time generating energy, and then it burns so hot, it moves through that energy so fast. So then when you take estrogen away, because that's what the ovaries will do to you, I won't take it away. But if you live long enough, and that's the goal, estrogen is going to go away. We're definitely going to see the brain fog. We're going to see the memory issues. And there's a lot of women in perimenopause, menopause who can relate to that. They've experienced that. And I know that Dr. Mosconi's work says like, oh, but once you're through perimenopause, things get better. I have not seen that be true for the neurodivergent brain. I have not seen the lack of estrogen and then things just level out. It's almost as if once that, and so this is what's different. The neurotypical brain has been scanned, and she's seen in the research that once you get through menopause, that roller coaster of estrogen, things stabilize. And it's not as bad as it was before. I have not seen that be true for neurodivergent brains. Once that estrogen is gone and they've lost that capacity, I have just seen that the struggle never ends and the deficits begin to climb more and more. What has been your observation?
100%. That's why I love lived experience research that is free, and people aren't doing it. The thing is, you can test this all in the labs, but to get the funding to really just look at neurodivergent women, it is a climb first, and actually so far I've seen
We
people
also have to know they're neurodivergent, right?
Yes.
How many don't even know?
Yeah, exactly. So far I've seen people who do kind of anecdotal research, they're getting the funding, but in order to do real biochemical, brain scan, brain imaging research, we're not doing that. And yeah, it is true. And women have told me that, okay, well, you think perimenopause is bad. Wait till you hit the post-menopausal stage, right? Estrogen just blip. And there are many neurodivergents who are undiagnosed, who I come to know in my life, women in their 50s and 60s. They don't take medication. They have HRT, and HRT has been able to help them.
Yeah.
And they were even wondering, do I need medication? So it is almost like a prerequisite for that stage in life, and we do hope that women get some support before we get to the postmenopausal, because we know that if you don't, that mental health, risks, can happen in that 10 years before menopause.
Yeah.
Which is what happened to me, actually.
Yeah. No, and for anyone listening, just to underscore what you said, we don't wait until 12 consecutive months of no period has happened. We need to start it earlier.
Yeah.
It's, I've always prescribed that way of like, if you are struggling, I'm going to prescribe now. I'm not going to wait until your period's gone. And literally I would have doctors writing me being like, you are not following the guidelines and this is like not the way it should be. And I'm like, but this is what works. I think that's the thing of like, I have friends that are autistic and they're like, I always want to see an autistic doctor. I'm like, right? Because they notice the patterns and they shift and they're not afraid to challenge a paradigm that's wrong. Like when you see that it's wrong, like you're not going to do that. And it's also something too, when you have a human in front of you and they're having a different experience. I love that you talk about the lived experience research because we need to address the human. I always say like, I don't have time. So I'm 44. I don't have time to wait for a research study to validate what my needs are. I will be far into menopause by then. Like I need to be intervening now, doing things now for my health. So, for people listening, we don't have to wait until you're officially in menopause. We can start things sooner. And typically it's starting progesterone. If you're early enough going to a doctor who recognizes you're in perimenopause, it's usually progesterone because you get the sleep disturbance. Sleep disturbance makes executive function non-existent. Ask any ADHD mom having a new baby and not sleeping. So it's usually progesterone that gets started, and then comes estrogen later as the ovaries finally are like, oh, we're on our way out. And testosterone is part of the conversation whenever estrogen is. And the reason for that is your ovaries produce 50% of your testosterone. But if you're neurodivergent, your adrenal glands are the other 50%, and they've already been working overtime your whole life. So I see often that the DHEA production from the adrenal glands, that typically starts declining at age 25 in neurodivergent women who have been high masking, what gets called high functioning, but really just like high masking, showing up, trauma they haven't dealt with. That DHA isn't the level we need it to be at to actually be able to produce some testosterone and even some estrogen from that.
Yeah, that is so interesting. Like I find because we're talking so much about estrogen and progesterone and not enough about testosterone. And you're right, the research isn't fully, kind of out there yet for neurodivergent women and testosterone, but it's almost like you have to kind of understand your own biochemistry as well before we even start with this. And as you said just now, with progesterone, is when you introduce it to some women, it's like, okay, but then there's other women, it can completely dysregulate a nervous system that's already sensitive. As for me, like I found that, if I take the full dose that they recommend to protect, the full dose of progesterone that I need to take alongside estrogen for half the month. And if I take that, I become really groggy the next day.
Yeah.
And like also down, which is interesting.
Mm-hmm.
And then so I take half of that, and sometimes I forget to take it. So that is not in the NICE guidelines.
Yeah.
That's not in the research because they haven't done that research yet.
Mm-hmm.
And they say if you want to go down that route, then we have to check your uterine lining in a few months. And
Well, you can also always do vaginal suppositories, which is yucks. I've had to do them. They're not
For
fun.
progesterone?
Yeah, for progesterone.
that's what I do.
Yeah.
I didn't even wait to find out what it's like to take it through the mouth.
Yeah.
I just knew that. But even that, so that is the milder effect for me then. But it already is quite a lot for me.
Yeah.
Yeah.
It's interesting because there's a subcutaneous injectable here called Moteris in Mexico. And I don't know if it's in the EU yet, but it's what is used in fertility treatments. And I found when I injected that, oh man, never have I been happier in my life. Like I was so happy. And I'm like, there's something about this subcutaneous. And I think because it's not like this bolus that just hits your system, it's going to be this sustained over, a day or two that you're having this absorption of progesterone that really, I was doing this as part of fertility treatments and really worked well for me. I also did 600 milligrams daily, 3 times a day, 200 milligrams suppository, and it never had that effect on me. But that I'm pointing this out because this is a different, like here, you have an AuDHD, I have an AuDHD diagnosis. I can take oral progesterone. I sleep like a baby. I feel great. You take it, you're groggy the next morning and you're feeling down. And of course you're like, I want people to know that there are doctors who will say, oh, well, that doesn't happen to people regularly and it must be something with you. If allopregnanolone, it's coming from progesterone, affects your GABA receptor in the brain, GABA is a big stop. You don't get the excitatory neurotransmitters. GABA's like shut everything down. Of course, you're going to describe it as feeling down, but I just wanted to point out the differences because we have the same diagnosis. We have a different experience with progesterone.
Because I have maybe I don't have the same thing you do and you don't have the same other extra co-occurring conditions. And that's why I talk about that as well when we look at support. What I said before was POTS. And also what I've come to realize is CAS that will be triggered by different things in my life. One of it was a flu in January, and then also emotional stress can trigger that. Having that histamine, overproduction. And so with POTS, if I have high estrogen, then I'm kind of hyperactivated. My blood vessels are pushing, kind of squeezing. And then when I have progesterone, it can help to balance that out. But if I forget to take one or the other, then it's kind of like, what's going on here today? Like my heart is becoming really fast. I almost have to hold it here to keep it regulated. And that is something that will always follow me. But also at the same time, I think sometimes when we know so much about our body, we can look too much into it. And that may cause the anxiety. I think like if we can balance our lives, in terms of doing other things to regulate our nervous system, then half of the challenges, it doesn't have to be supported by just medication or hormones. And the reason I know this is because I've lived for quite long whilst in a perimenopausal stage without knowing, because I potentially started in my late 30s feeling like that. And then I gave birth at the age of 39. It was double whammy, triple whammy. And then last year in my heart, I thought I was having a heart attack because I was at the very, very, very stressful month with like over 30 talks I had to give in 1 month. And then I was on a higher stimulant dosage than I needed. So then my body wasn't clearing it, but also I was pumping stress, through my system. And then one day I was like giving a talk in Farringdon and I just stopped breathing. And I was just thinking, this is not good. How am I going to talk if I can't breathe? You can actually do that. I just realized you can talk even if you don't breathe. And I really didn't know how to recover from that. I did lots of tests with my GP, and they said, no, you don't have an irregular heartbeat, but my aura ring was showing me that cortisol was spiked, through the roof. I then considered like lowering my medication and, did lots of things. But then one thing happened where I went to a yoga retreat and I ate vegetarian, like vegan food for a weekend. And I thought that was it. Then maybe I can like go detoxify and all that. But then now looking back, that wasn't it. I went to the yoga retreat and there were lots of breath work. There were lots of singing. There were lots of regulating through movement. And I think like you can eat all the good food in the world and maybe be the healthiest you can be. But if you have a stressful environment, whether that comes from work or relationships, then you're still going to need support for that, and that is so important, such a core part, and I really think it boils down to our expression, because what we don't express, we suppress. And with that comes lots of health issues. And to quote our friend Gabriel Mate, it said, if you don't know how to say no, your body says no for you. And I truly felt it.
Yeah, I think I would love to hear from people in the comments if that's ever been their experience. Was so much my experience in my 20s of like, I didn't say no, and then I would just get so sick. And then I remember there were times where I was like wanting out of things and I'm like, oh, I wish I could just get sick. and then, adult me, like, I was technically an adult, but my brain wasn't totally formed yet. Was like, wait, you could just say no, but that was never modeled to me. That was never something that permission had been given to be able to say no. I wanted to ask you, you said we are seeing an exponential rise in women being diagnosed with autism and ADHD since the pandemic, with those 23 to 49 now the largest group receiving the ADHD diagnosis. Why is that?
So there are a few factors here. There's always is something in that complexity, in that we see like generational differences, but also we see the female labor burden. And with the earlier ages, the 20s, they're the Generation Z. They don't take no shit. And they also are very aware of mental health and the language that comes with it. TikTok diagnosed a lot of people.
Yeah.
Especially the ones in the Gen Z and the early millennials. And then with us, the older folks.
You're still on TikTok.
I guess. And cool and trendy and pink. We are, dealing with increased demands.
Yeah.
And there's nothing like a pandemic to tip that demand over the edge. And that's when we couldn't cope with that overflowing demand with no outlets, and there were a lot of people who had a lot of alcohol during the pandemic, as a way of coping. Then there's also when people were at home filming videos talking about ADHD. And that's how I found out, about female ADHD.
Yeah.
So that
through TikTok.
No, actually, through Instagram.
Okay.
Yeah.
Meta, you're still in the ring.
I feel a bit old for TikTok, but, it's cool. So, that's how I found out. And there is that 23 to 49 years kind of age group that stats was cited in a Times article in the UK. And they say women, are the largest contributor to the rise in diagnosis, which then made, people want to specialize in it to make money. But for me, it was always about just trying to work out what happened to me and what happened to us, and that's when ADHD Girls was born, really.
So I really appreciate you saying that, because, and I want to go back to the fact that I do want to acknowledge, and I felt like I didn't acknowledge this properly before then, the high needs group, the nonverbal, usually the intellectual disability co-occurring autistic, which everyone's like, oh, that's just autism, but it's actually a co-occurring condition with autism. Those people don't have a voice on social media in the same way. I will say that I have come across nonverbal creators who are doing written text, and they're still showing up, that they are underrepresented. But what's interesting is that they're underrepresented on social media, but when it comes to what the U.S. government wants to do, this is all they're focused on. is those with the intellectual disability co-occurring with autism and saying, oh, the rest of you, you're not really autistic. You're not autistic enough, which I think is a whole other challenge. But there's been a big concern about the rise in autism. And I have been out there saying, we are seeing more adults diagnosed, like this umbrella of there are this many people now diagnosed with autism are people who always existed. So sometimes when we're chasing certain things, in the US right now, they're very much, the government's very interested in like, are vaccines causing autism? And we're back to, that conversation that I feel like has always been around. It just like kind of peaks and dips. But that, that whole conversation, I'm like, hold up. But this big number rise that you're calling this epidemic is because so many adults now are finally being recognized. And it is incredibly painful, I think, when you see leaders of a nation saying things like, you're not autistic enough to worry about, or you're just fine, when you've struggled your entire life, especially with all these co-occurring conditions. So you've talked about POTS, mixed connective tissue disease, autoimmune diseases overall. There are so many, like not just mental, there are so many co-occurring conditions that nobody has even recognized those in this population. And they've been told things like, you're malingering, you're drug seeking, like you just want attention. And in reality, you're neurodivergent.
And that's why I think you do the work you do. And I want to address the fact that ADHD isn't just in the brain, or autism, isn't like something that people think, because you're looking at, a population that has co-occurring conditions in nearly all the organ systems in our body. And our way of being, predisposes us to those conditions. And the pathway to that, can be burnout. It can be all sorts of life changes. And that's why, even though we look like we have lower support needs, what we don't know is that what is happening internally in our body that is causing people to have ill health, and I know people who start medication after ADHD diagnosis who actually I can really see that if they go down this route of like just overworking, because that's what the medication does actually. It kind of shifts the energy into your brain and get you like to disconnect from what's happening down here and from the neck down. And it's not good for our health. And eventually we're going to run into health issues. And it happened to me quite quickly within 2 years. And now I manage it. I still take medication because I started with that, and I just manage it with other things. So it can be a tool in your like ADHD or AuDHD management, but you also need to know what is going on, in your body and in your health.
Yeah. And, to the point of talking about AuDHD, I have like all these quotes actually in my questions from things I've seen you say, but you've said many AuDHD women are still dismissed in assessments that separate autism and ADHD, despite research showing they co-occur in 80 to 90% of cases. So what is going on there?
So like you went into your like you're saying, do you mind me saying about your diagnosis, your autism diagnosis, where you said you didn't?
Well,
sorry, I already said it. but you can cut this out.
No,
you can cut this out.
I've talked about it. It's funny that you found out on Instagram, because I can talk about it on Threads. I can talk about it on TikTok, and it's totally fine. People are like, yeah, whatever. And if I talk about being autistic on Instagram, like I've had to take down posts because people have just come at me being like, you're just seeking attention.
Oh my God.
You're just trying to get on this trend. You're like all of this stuff, like stuff to the point where, and it's just something that I'm going to say that for everybody listening, I've never interviewed a podcast guest that hasn't experienced bullying online on social media. And it really makes me think, like, as I've talked to so many people on the podcast, I'm like, what are we doing as a society? What are we doing as a society bullying people online? So anyhow, you can talk about it.
Okay.
I just was putting it out there that like I do talk about it, but you won't often see it on my Instagram because for whatever reason, it's where the self-identified autism moms who are like, autism is only high support needs. And if you're anything else, like you're taking away from my child, who are healing their own wounds. I want people, don't go after autism moms, because I feel like they're living in a society that's giving them absolutely no support. And sometimes people are even saying this is what you get for creating a child that has deficits, and my heart breaks for them. So I just want to be really clear that I'm not dissing these people. I'm saying that they do have their own wounds, and that I can understand and respect why they will act in the way that they do.
So is like everything you said is the reason why I actually created the AuDHD life experience research and ran the event for women. I was dismissed in my autism assessment 4 times, and the whole process took 7 to 8 months before I finally got a diagnosis. And the thing is, I wanted to see what this process was like. I wanted to see what the system was like. But at the time, I didn't know what AuDHD looked like in women. We're talking 2024, like July. And yeah, they knew that I had an ADHD diagnosis. So a lot of the symptoms are like, was that ADHD? Oh no, that's trauma. That's trauma. That's definitely not autism.
You're a woman. You have ovaries. Yeah. It's trauma.
Yeah. Also, then the criteria that they used to assess me, the ADOS-2, was very male-centered. And I brought it up, after they said no the first time. What about a masking scale? And they were like, yeah, we can do that. And then they didn't. So the next time, it was like lots of invalidation. I was just crying every time because the questions that were asked very much hit the kind of relational wound, where like the bullying that happened in university, and just never really feel like you fit in. Like that was me, and then also then using the intellect to be useful or to fit in because that was the place I had a role, and so all this is not easy. Actually, a lot of women say that the autism diagnosis was far harder. The assessment was far harder than ADHD because with ADHD, you wrecked your life. You had like self-medicating and you have problems like when this area. Okay, you have ADHD. But with autism, it's so much more intimate and intense. And so because of that, I launched the life experience research, asking ADHD women or women who identify with both autism and ADHD what it was like to live as an ADHDer. And I checked what do these traits look like to you? Hyperactivity, impulsivity, inattention, social communication, repetitive behavior and interests, sensory challenges, mental health, hormones, like loads of stuff, co-occurring conditions, things that people don't ask you in the assessment. And so I feel like there isn't really this checklist out there. And it needs to be developed. And also people have asked, why can't there be a dual diagnosis? And there is now. It's just very expensive. And
it's only been, less than a decade since the dual diagnosis has been allowed. And for people who, there's some people, you might be autistic, but who get really rigid about the DSM. And so when I'll talk about emotional dysregulation in ADHD, they're like, that's not part of the diagnostic criteria. Therefore, it's not part of it. I'm like, it might not be part of it anymore, but the DSM was never made for the patient experience. It was made for the clinician's ease of diagnosis.
I actually wrote an expose in psychiatry in my
you?
book. Yeah, in like step 1. It was like the APA. I'm going to get like probably cancelled here.
Come for us. I dare you.
It's like the APA, is represented by the dominant culture in that certain, part of the world. And the people that they say are inclusive, were brought into the conversation. But I have been in rooms, because I work in DEI in the early days, I have been in room where if you are the minority in this culture, then your voice isn't as loud. And then there are people who hold this invisible power. And those power dynamics are like very much like who's given the opportunity to talk and speak, and these things aren't discussed. They are like the DSM is very reactive. Like it's been changed when George Floyd, was murdered, and then they add a cultural angle to it. But do people use it? Some people don't even know it exists. There's a cultural lens that you can use within the DSM-5. There's a section in there where you look at how someone looks for help, for their challenges, and what are the challenges regarded as in their culture, and what does the culture think of that, because often there is a cultural control, and that is not just within that culture, is that culture trying to survive inside a bigger culture. And we know for a fact that these things, people are talking about it, but it isn't recognized in medical profession as a thing. And I wonder why you get raging women. You know?
I actually was talking on another podcast episode. I can't remember who it was with. If I find it, guys, I'll link to it, about like how I have, talked with counselors, and I've worked with like spiritual intuitives, and they've been like, you have this rage here, and like you need to clear this rage. And I am always like, no, I will be keeping that. Thank you very much, because I don't take, a lot of people know my story. I mean, I'm late diagnosed AuDHD. I'm also late diagnosed endometriosis. And like, there are things that medicine has done me so dirty in, and it absolutely pisses me off. And I've had a lot of heartbreak. And I'm like, I'm not going to just let that go and move on and kumbaya my way out of this. Like, I'm going to be mad about it. And I'm going to take that anger, because it's energy, and I'm going to channel it into making sure it doesn't happen to other women. And I'm going to talk about it, and I'm going to share information about it. I'm going to give resources about it. And I think that so often the term female rage is used as a way to like try to put us back in our place, like label us and push us back to be quiet, smile more, just be a polite, good girl. And where has that gotten us? Sick, dead, dying. Like, no, like this is not good. Like, so we have to speak up. And I think that having rage that you would channel for, whether it's for your life to be better or for the greater good, like that's not a negative thing. Like you're getting it out, you're moving it out, and you're creating purpose from pain.
Yes, I love that. You have the Shiro archetype, and I've seen it,
Stop, I'm a kid of the 80s. I love She-Ra.
Oh, yeah, but then it's so cool that, you are using that, what people think as intensity, as perhaps the thing that you were born to do. Maybe God made you that way, so you won't be quiet, and you might be tested along the way, but that only makes you stronger. Because if you weren't born that way, then you will just, be beaten into submission, but you won't. And because of that, you are healing yourself alongside healing other people, and that's why people trust you. I think that rage, when channeled, into the right place and being allowed to be expressed, is going to rebuild the world, but first we have to set it on fire.
Mm-hmm. Well, I actually grew up near Yosemite, and I will say that great forests do have to burn for new life to grow, and it is the reality of nature. So why would it be different for us? Do you think that it is easier for women to get a diagnosis of ADHD than to get a diagnosis of autism? Not just from the like answering the questions and checking it off, but do you think medicine actually would rather, like they think it's okay, like ADHD, that's fine, but autism, I don't know if I want to diagnose you with that.
Yeah. So again, that is so varied in different people, because I think like it's easier to spot female ADHD if someone's, persistently showing chaos in their life. But what if they have support? What if, they found a safe system in their family? Maybe those people won't even look for a diagnosis. I've had encounters with women who have stopped self-medicating for years, and then when you see them now, they appear more autistic, because they say female ADHD looks like the female autism phenotype, when you're not in chaos, so it is hard to discern. But at the same time, it's what has your life been like up to the point where you land in a psychiatrist's office? So yeah, it is definitely easier to see ADHD or not. Like sometimes you get women who are ADHD who may be more autistic in their presentation, and they don't get validated for the ADHD diagnosis. So it can go both ways. And for me, because I was already medicated for ADHD when I went to my autism diagnosis, and they're like, nah, you're fine, it's trauma. And then a few months afterwards, Jolene Brightens work came out, and that book, it was like, New Scientist was on it, a Times article. I'm sure she's getting lots of airtime for a good reason. And she said, I really respect Jolene Brightens for this. She said that she had been part of the problem that she was trying to solve. Because for decades, she said, there's no gender differences with the, brain. And then I was like, yes, there is.
Is she in that, like, what would be boomer generation?
Yeah, I think so.
Yeah. So there's very much, that's the thing I've observed, is this mindset that like, we are no different. Anything a man can do, we can do the same. Like women's hormones. Well, and there are also the people that were like, just take the pill, then your hormones are more like a man's and you don't fluctuate and you can keep up with them. And I think it's been our generation and below, younger, who've been like, well, how's that worked out for you? It's not really worked out for you, but also we are different. Why wouldn't we embrace and celebrate our differences? But I think the world changed just enough for us to be able to do that. I mean, it's changed just enough, right? That so many, like, we can talk openly. I mean, there are certainly times, and I will say, actually, for my most recent book deal, I definitely question in the back of my mind the way some publishers responded to me when I talked about being AuDHD and seeing their faces. And I do question of, like, did they value me less? Did they view me differently? There's definitely things that, like, granted, I'm not the best at social cues, but there was a pattern in which it happened 3 times that I was like, among people, that it really made me question, like, did they suddenly see me different? Even though I've written 3 books and this is going to be my 4th of a book, like, and it is because, well, it's funny as you talk about, like, blowing up your life. Some special interests are really well embraced. Special interests in science, hormones, like, that I could hyper focus, like, through medical school, like, all of that really, like, celebrated. But I think there's other parts of, being, talking about this openly that maybe that isn't totally accepted. And so I'm saying that because I started down the train of, like, oh, things are more accepted now. And I'm like, but are they? Like, there's definitely moments where perhaps they're not, which is why conversations like this are important.
Yeah. And I think it's so important to break out of that echo chamber, because I totally recognize when we're talking in these rooms and when we go to these community events, there is a curiosity for people who may already be quite receptive to listening, but the rest of the world are still being fed a diet, of what is in media articles, films. And so they aren't up to speed yet. Actually, my book that I wrote was actually especially for the other half of the population who actually do not know what neurodivergent experience look like. And I also created the first AuDHD in women intersectional and scientific training that trains medical professionals, like those who diagnose and support AuDHD women, to try and understand what our experience is like. And then doing campaigns, like podcast is something amazing. Like, I'd love to be doing that someday, but I'm really much focused on the events that are good at the moment. And I think like these conversations really need to break out of the echo chamber, and people do not understand that actually AuDHD, we are human beings. We might have some differences and quirks, but actually we're not less than, we're just different. And understanding this difference is the first, step to actually just crafting a life that we can, kind of be happy in, and maybe more acceptance and more compassion. So yeah, I totally hear you. There is that shift in, like, so something in the air has changed.
Yeah.
When we talk about the label.
For people who are not familiar with how autism presents differently in women, can you give like a list of how it looks differently? Because I think you're right in that media has given us young Sheldon, which I actually felt pretty seen in that show. There were moments where I was like, oh yeah, like the not wanting to shake hands. There's definitely things that, like, I'll just out myself if I shake someone's hand that I'd rather hug you, and I hugged, that I will think about my hand until I can wash it. And it's almost like it's burning and it's all I can think about.
Yeah.
So there's definitely things, about it. I'll share the other, because here's the thing, you're like, there's quirks. I feel like I'm awkward. I am definitely an awkward person. The other awkward thing is my son, he was like, oh, if you were like any superhero, who do you see yourself like? And I was like, oh, I'm like Tony Stark. I'm like Iron Man. And he's like, why? Because you would invent stuff? I'm like, no, because I don't like to be handed things. I don't like people to hand me things. And I also don't like people like getting too much of my space. And he's like, oh, it's because you're weird. I'm like, yes. It's totally, but that's where my brain went. Anyhow, we're going to talk about female autism, but that's just some of my weird things. You can share your weird things too, if you want.
Yeah, a big one that actually most autistic women really identify with is a difficulty reading people's intentions. And that has been one of the biggest challenges, I would say, in my life. Not perhaps actually knowing, but actually not being sure, and even if you do know, you don't know what to do with it, then that causes a challenge as well, and being hyper empathetic. And that comes from having that strong drive to connect, to actually be accepted socially, and that can lead to camouflaging. And so we can hold eye contact. Might be uncomfortable, but we can do that for a bit until someone points it out, and then you look at each other like, RSD is really strong in the community.
For people who don't know what RSD is.
Rejection sensitivity dysphoria, because not just autistic women, but women in general has a stronger activation of the default mode network, where it leads to more rumination, overthinking. And with autism, that's like persistent, like kind of expression of that default mode network, overthinking, which worsens during luteal phase and like hormonal transitions, and that's where the hormonal interplay gets into it. And like someone's told me, like, it's not really called special interest anymore. It's called something else. And yes, people are very good at keeping up in the community, and that's why it's nice to talk to them.
Terms are always changing too. I know, I can't remember. I know that they change. They are like, now let's call it, instead of special interest. I take a little bit of an issue of always changing terminology, even though it might better suit the community when we're trying to raise awareness and actually get people like neurotypicals to wrap their head around things. We see this a lot with other communities. Well, polycystic ovarian syndrome, terrible name, absolutely horrible name for the condition. Yet it has been generations of trying to raise awareness, and finally legislators are starting to pay attention. If you change the name, you set everything back. So it's a tricky thing where I'm like, I want to do what's best for the community. And also, like, when we talk about camouflaging, I'm like, everyone calls it masking. Like, masking is the word that we use. Menopause hormone therapy, yes, that's a thing, but HRT is what everyone knows. So that's what we're going to use, because we have to meet people where they're at, based on that. So I'm sure special interest, I know it has a different term. And if we were talking only to a neurodivergent community, we would make sure we had that term right. I'd be Googling right now.
So, exactly. And then I can't keep up with all the name changes. so I would just have to say special interest. And you're totally right. We have to meet people where they're at. And that is one of the vein in my life, because whatever I do is based on like what my discovery is in my journey. And to some people who are just looking for that diagnosis, my interest is now here, and they're here, and I got to kind of come back. And so with the special interest, it's for autistic women tend to be more psychological, human-centered behaviors. And so you get a lot of autistic women in the helper profession. But there's also things that regulate our nervous system, like music and crocheting, and knitting. Some women are very interested in sex. and so there are things that may not be typical for autistic men, to like, that is very much maybe more suitable for women, or maybe what the culture thinks and accept as normal, because maybe there is a drive for us to be more accepted, which we have found that to be true. So then, that is often why we are missed, because we do, present differently.
Okay. Yeah. The other thing that I have seen that was really, because I always thought, oh, my special interest is hormones. And then I saw this psychologist saying in our clinic, female autistics love plants. And I was like, and at that time, I recently moved, so I had to part with my plants, but I had like 75 house plants. And I was like, it might be me. But I'm also, I also find that a lot of the things that autistic women are into in special interest goes back to that utility wound you talked about before. It's about, how do I have value to other people so that they want me around? Because I think that when, as you were saying, so reading intentions is difficult, reading social cues is difficult, but there's also this longing to belong. And I think that women find themselves in this place of like, I have to have utility. Otherwise, I won't get invited to the party, or I won't be, part of the inner circle. I certainly experienced this in a community where I was living, where people were having like events and I wasn't invited to them. But when they had a hormone problem, those people always texted me. They always called me. And it's so when you were talking about the utility wound, I was like, oh, that came up for me recently in the last year, where I was like, oh, I need to put a boundary up because I'm thinking we're friends. And I think that's another problem with autistic women is that we think we're in friendships with people who aren't actually our friends. And it's something that I'm doing with my children. I wish someone had taught me as a child to ask, what makes a good friend? How do you know someone's being a good friend? And how do you know if someone's just using you? And I had this epiphany of like, wait a minute, all these women are just using me because they're always my friend when they want something from me, but they're not my friend when they're like having parties or inviting people over, or I have a birthday and I invite them and they're not coming. And so I think that's something, I'm not sure if that's an AuDHD or ADHD experience as well. I would imagine it is.
Very much so.
Yeah, but very much an autistic experience of like, you have to have a special interest of value to people so that you are kept in the community.
I guess it works both ways as well, because you actually love to, find out more and talk about it. So you naturally do talk to people about it, and that's when you light up. That's one thing that I actually have been described in my autism assessment by my ex-husband, who was my developmental witness, which is another reason why I didn't get the autism diagnosis. Is that,
geez.
yeah, so
Bro.
he said, but he said that I can go into a monologue. And then he's like, not interested. And I'm still talking. And he's like, okay, when someone's going to stop. And I didn't realize that. Because when it's so interesting to you, and you talk to somebody who maybe you work with, like what we're doing now, we're really charged about it, but then other people aren't. And that is one thing that perhaps I don't see sometimes, but there is another element that, okay, then the friends who are with me now, do they want to be with my friend because of me or because of what I can give them? And that has been my journey as well, to find the people for me. And it is, I have other autistic women who ask the same thing. Like, would they be my friend if I didn't do this thing? And we're all trying to work out, where our place is right now and how to just kind of have friendships and relationships with people. And I think it's very timely that we are talking about this right now.
You mentioned earlier that the AuDHD brain is different. How?
Yeah, so there was a paper that came out in 2023, and I've messaged the lab. They haven't got back to me. It was a Japanese lab, and that paper is by Watanabe and Watanabe. And they look at the AuDHD brain dynamics of children compared to ADHD and autism. And so that paper, I realize, is not very gender inclusive. I think 30 boys and 3 girls for ADHD. And they found that there is a different brain pattern that tends to happen in the ADHD brain. And that differs from pure autism and pure ADHD. And they had something that looked like a Venn diagram of ADHD. It's kind of semi in the middle, but then it kind of overlaps with autism, social communication pattern. But it doesn't with ADHD. So then the AuDHD phenotype looks very much like the social communication of autism. And in my observations, it's not been validated by scientific research, but just by looking at the community events that I hold, by coming across AuDHD women, we tend to have more of that female autism phenotype, but then we're quite different to ADHD. So they say with ADHD, that's that difference in switching attention, but with AuDHD is more about task switching, because you are dealing with a brain that is both control and rigidity and instability, like over flexible, so then we can go from a state of being very hyper rigid to completely over flexible. So then it can confuse people when you see that come up, so that's how I realized that AuDHD, they say, that is a totally different brain dynamics compared to pure ADHD and pure autism. And several other papers have been published now to look at that, but still not that many gender, looking at just women or men. They're still like quite early days. And from what I've seen, many AuDHD men have also say that they're very into like hyper, like empathetic and, tuning into environment to see what is needed, the camouflaging, the masking is also very, very prevalent in the AuDHD man community. So we don't know yet, what goes after this, but what I do know is that, that brain dynamics also make you loop in a very familiar pattern, and that's why when we go into relationships and encounter trauma from that relational injury, we can look like we have disorganized attachment because on the one hand, oh no, I don't want to do this anymore. And then your brain loops into this pattern where you're like, oh no, I want it. I don't want it. I want it. I don't want it. I want it. Yeah. Number of relationships I've come across that AuDHD and that works that way, the push-pull and, that disorganized attachment style, that's very prevalent.
Mm-hmm. When you talk about, so you said the AuDHD has more of the autism phenotype in terms of communication. How does that look different than the pure ADHD communication?
I guess with ADHD, there's more of that overwhelm, and that chaos and that socially, like just trying to overfunction socially. But then they hit a point where they will just not be able to do it. Whereas with autism, there's more camouflaging that actually you go all your way out. But then with AuDHD, what's interesting is that we know what is expected, but we may be more unwilling to do it. Mm-hmm. Like there is a deeply autonomous neurotype that actually, unless we're doing it for us or our way, we're not going to want to do it. Mm-hmm. And yeah.
Do you find that as a struggle in your life?
Yeah. Hugely. That's why I don't have many friends.
But I see this I see it play out in my children as well, where we're like, this is the way I planned on doing it, and I can recognize it in them, so I can hold space for them and be like, oh, but sometimes I'm like, no, it has to be mama's way. But it is very much something that my husband will be like, I don't understand. Just do it like that. I'm like, I can't. Yeah. It's already been decided. Yeah. The neuronal pathway was laid down 2 days ago. You don't even know. It's got to be this way.
Yeah. You can't fight it either. It's can't do anything about it. Sorry.
Well, that's the thing that you bring up is that a lot of people think, why don't you just act better? Try harder, do more. But on a neurochemical level, it's just not possible. Can you explain that?
It's also like a brain network and then brain energy dynamics level. Because that paper with Watanabe what was interesting is that they look at the energy patterns in our brain and how our energy, the energy flows, when we encounter certain tasks. And so it's like, when you go into the rigidity stage, then you almost have that overstable, rigidity that will make it quite hard for you to do what other people want from you. But then when you go into that over flexible, state where you just kind of throw caution to the wind and you just say yes to anything, and that can also be confusing to other people. I think that's why so many people think we have bipolar or borderline, when there's relational trauma involved.
Yeah. 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 Or just labeling someone a narcissist, which I think is an incredibly lazy thing that people have been throwing around, to where I'm just like, that's so effortless to just be like, they're a narcissist. It's a way to dismiss people without recognizing that actually there's something more under that layer of what you're just perceiving. And I also think as humans, we are very selfish. And often when people are interacting with a neurodivergent person, they're perceiving what's being done to them instead of ever saying to themselves, well, what is their experience? And it's something that, I will often say of when somebody is behaving in a certain way, what has happened that has led to this behavior? Why is this the expression in this moment? It's, going back to the autistic moms who lash out. What's at the root of that? If we go back, these are people who are not being supported, who feel helpless, who feel like they're, trying their best and it's getting them nowhere. And that is leading to this behavior. And it's not that this is, it's being directed at me. It's not being done to me with purpose. purpose. This is an expression of somebody who has this internal trauma, this grief, this dynamic in their life that they cannot have any control of or fix.
Yeah, and especially when you are maybe also autistic, caring for an autistic child, you got to think about the sensory challenges as well of that. You know, the thing you said about like when your child dysregulate, and if you're not in a place where you have energy, then it's going to be quite hard for you to be there for them. You know, and traditionally, our parents weren't taught to hold space.
No.
We grew up with none of that.
Yeah. Well, I don't know how it is for your family. I come from a Hispanic family, and it very much was like chancla culture. Like, you're going to get a slipper upside the head, like a sandal. I'm like, what do you call it? We call them flip-flops. You know, like, you're going to get smacked with that. Like, if you do not behave, I look at like, how well I've been able to mask and camouflage through my whole life. And it's like, well, I grew up in a culture that there was, I mean, even, you know, a lot of like Mexican culture is not, you think you have mental health? No, you don't. You have mental health issues? No, you don't. Like, no. Like, you need to drink water, take a nap. Like, that's just not what's happening.
Yeah, exactly. And that's the culture control, you know, because everyone says it doesn't make it normal, you know, and if you know how it feels like in your body, and if you then go into a different culture, then you see actually other people seem to validate that as a challenge, but not my culture. And yeah, that's still something that I recognize from my Asian roots, you know, being in the UK. People don't see therapy as necessary, you know, and yeah, so it still feels like a big privilege to have that.
Yeah. Well, and we were talking before, and you were like, wow, you got your autism diagnosis. And I was like, I had to private pay. You were in the UK system, which I just hear horrific things about people trying to get an autism diagnosis. And it's not, I think people think like, oh, people are trying to get this diagnosis. They want this diagnosis. No, they just want to know why they operate in this way. As you were talking about, you cried during your assessment. I cried during mine. And I can't even remember the question, but I remember my answer of just being like, everyone, my whole life has felt like everyone else has had like the rules to the game of life. And I have been spending my entire life trying to figure out how to play this game right. And I can't. Like, no one will just tell me, like, what are the rules? How am I supposed to operate? And so I feel like I'm constantly failing. I'm constantly putting so much effort in, but then like I miss the mark on that. And then, as you were saying, the rumination happens, and then you're dwelling in that. And I just remember crying in that moment. And I'm also someone who's like, I don't like to cry in front of strangers. Like, yeah. But it was just, you know, people will often ask, like, why bother getting the diagnosis now? Like, you've gone your whole life. What do you say to that?
Oh, because of all the potential co-occurring conditions that I could find out how to manage. So it was only last year that I learned about POTS. I lived my whole entire life not knowing about that. And that was why I nearly had what I thought was heart attack. And I know that an autism diagnosis doesn't give you much more than a brochure, you know? So it's really like, okay, what is the point? The point is actually, if you know that is you, then it's quite nice to be validated for it. But it's also quite strange when you're getting it from a system that actually doesn't know what it's like to be you, you know? So there is absolute point, because there's so many, you know, transitions and stages in our lives where being autistic, ADHD, you know, that can throw a spanner in the works. I want to know, and I want to be prepared, you know, because I naturally have that anticipatory preparation thing, you know, or anticipatory anxiety. And as to your point about not having a manual to life, I've felt it as well. And I've heard other ADHD women tell me the same. Like, they feel like they're an alien who's landed on Earth and have to watch humans, you know, and it's by watching that we learn to camouflage. And then now I realize more and more that actually perhaps I'm just built a different way. And it is something that I need to get comfortable with. I'm never going to be palatable to everyone. I'm not going to be like them. And it's constant work to show up just as me and be authentic. And it's to find the people like me as well. And when you do, oh, it's so nice. You can tell each other, oh, I understand when you're overwhelmed, and I'm not going to call you because I know you're working. And also, if I'm sitting in a corner, in a group event, it's because I really can't be bothered, and that's okay. And it's like when you find those people, then you don't feel like you have to be different than you, and that can feel so nice, and you can sleep at night.
Yeah.
And there's a lot of relationship audit, that we had to do to like figure out.
Yeah. And I think your point about the co-occurring conditions is so important to understand that you're going to be at higher risk for so many things. I mean, it wasn't until my endometriosis diagnosis that I was like, wait a minute. And I went and looked, and there is research showing that autistic women, ADHD women, and, when we talk about this, OCD, Tourette's, like these other neurodivergent conditions, they do fall into these buckets a lot of times. And we see there is a higher incidence of endometriosis among these women. And so one of the predominant theories of endometriosis, what I think is the best at this time, is that during embryological development, something went awry, and cells that were to become the uterine lining and migrated and ended up other places and then responded to our hormones. And so this is how we end up with endometriosis. If you think about that from embryological development, something was different in the programming. I think you can start to understand how someone can develop into a neurodivergent full being, and it not being something that like was just, just because it was trendy, or just because some environmental insult got introduced. I think, and I'd love to hear your thoughts very much, that of all these environmental insults that we've seen that people are trying to attribute to the cause of autism, I do believe that what it is that genetically we're poor at detoxification. We have an overreactive immune system. Like, we already genetically have these differences, and they've absolutely never been studied with some of these medical treatments that we are administered. And so people often look to that and say, well, that must be the cause because things got worse. A switch was flipped overnight and things were so different. I have a child who experienced PANDAS, pediatric autoimmune neuropsychiatric disorder associated with strep. He got strep, it flipped his immune system, and overnight he was a completely different child. And that's, having lived through that and having seen the research, very much my thought of like what we're attributing to the cause, really, it always existed. This was a neurodivergent being in utero, but these environmental insults came in, and this individual did not have the capacity to detoxify, to regulate the immune system, to protect the nervous system. And now we're chasing these as causes when really they are exacerbating what actually existed. What are your thoughts?
Yeah, I love that. I love everything about that. I have so many thoughts, and I'm trying to organize it in my brain. And yeah, so I love the fact that you brought the biological systems into the discussion about, how much we know in the medical profession, because there is a disconnect here. And I've always struggled with the fact that, people who diagnose and treat and support neurodivergence generally don't have enough knowledge of how everything connects. And there is more of that, kind of like a connection, now, in conferences. And there is a need to link scientific research with medical profession and the lived experience community, because I give so many talks to the community because I love it. I just love women who are just like me, and there's no hierarchical difference. Because when we go to the medical profession, there is a power dynamics that we are immediately disempowered. And the thing is, we're not being heard here. Maybe we're looked at like, oh, your body, your brain, the system, You're actually like, oh, what's in the medical textbook? What did the conference say? Hello, human,
Yeah.
And then there is that scientific research. It's always been there. So I found this papers that looked at the biochemical metabolic pathways of that are impacted in autistic and ADHD individuals. There were all the things that you mentioned, nervous system, immune system, melatonin synthesis, GABA, and the body calming system. is dysregulated, and so much more detoxification, like you say, oxidative stress, the cell-to-cell connection, and so much more. There is also that inflammation that they believe to be the cause, for a lot of the co-occurring conditions that happen, right? But inflammation is a system, a process. What is inflammation, And that's when you look at the connection, right? Between the brain, the heart, the gut, in the rest of the body. And what do we do, to support somebody who has, these challenges? And for your son, like, perhaps there are very specific, treatment and support that supports the symptoms. And then we look at long-term, management. And so, yeah, there definitely is a need to connect biology with, how it manifests in the lived experience community. And I feel like we need to be the bridge for that.
How do you think it's possible that we build that bridge?
Oh, I think the thing is there's so many people who are working in the private sector who are trying to solve a problem, but it also looks like trying to profit from the situation. But like, how do we build a bridge? I believe that we need a personalized care framework, and that's because from everything that we discuss, if we're going to bring that, into the community, then they're going to have to find out what their unique way of being is like, even within the ADHD and autism phenotype. Then from there, we can work on it. And then we look at the bio-psycho, emotional, relational perspective. And for me, like, I always think in systems, but then, getting the biology, in the regulated state is the first step. And a lot of education. And for me, I've always thought of that personalized care support.
Yeah. It's what people are clamoring for. And yet this is another way that the system really has to be completely dismantled to be able to set out to do that. You mentioned melatonin differences. I know people listening are going to be like, say more.
Yeah, so our body may have challenges producing melatonin at the right time, and maybe also getting rid of it. And so that can cause all sorts of issues like, delayed sleep phase, which I know you've talked about, and getting up at wild times, especially when we get to the perimenopausal stage. Some women getting up at 2 a.m., having something. I can't remember the actual term now, but it's a form of insomnia where you fall asleep really early and then you wake up at 1 or 2 o'clock in the morning and then you don't sleep again until 5. And then the next day you're like a zombie. And so, we know also if we don't sleep well, everything breaks, breaks apart. We know that with ADHD, there is that, the glymphatic system, like the brain goes into a bit of a car wash and maintenance when we're asleep. And if we go to bed late, then there's less of that. And then if we, don't have sleep, then that's even worse. So yeah, we have this regular upkeep that's very necessary. But when we have the melatonin imbalance, that is not just innate, but also can be brought upon in our life stage of being perimenopausal, like having hormonal difference, then that can really throw a spanner in the works. And what are your thoughts on it?
Yeah, well, the other piece of it, so there's the delayed, and then there's the fact that people aren't just getting sufficient melatonin, is that that's also a really important antioxidant. And so, as you were talking about how medicine likes to be like compartmentalizing things and just being like this for that, and that is all, but melatonin being a part of sleep is also protecting your cells and it's protecting your brain cells. And if you think about, the neurodivergent brain tends to have more free radical oxygen species. This is very dangerous. And I think that this may be a contributing factor of why we see such a higher risk of dementia, especially among those with ADHD and who are untreated, is that, yes, there's not the sleep, but there's also not the antioxidant protection happening in the brain. Then you add on the fact that there's eating issues among ADHD and autistic people, right? Like, you're like, eat a rainbow, and they're like, but it's yucky, or it's boring, or I don't want to have to prep it, or I'm overwhelmed by the produce section in the store. That I think that's another area that we really have to bridge. And I think that that's also been an issue with ultra processed food coming in. People will say like, oh, it's the ultra processed food that's causing ADHD. I don't think that ultra processed food is causing ADHD or autism just by fact that it existed before we had ultra processed food. But I don't think it's helping. And I definitely do think it can make symptoms worse. I mean, if we go to the gut-brain connection, we know that's huge. There's a lot of gut dysfunction. It's interesting because when I got my diagnosis of autism, I was like, all the digestive issues I had my entire childhood. And I looked at that and I was like, oh man, like that was a sign right there. I don't think actually back in the 80s and 90s, we understood that the gut dysfunction that can come with being neurodivergent. But I look at that piece and I'm like, of course, of course. Can you talk, a little bit about because you mentioned the gut aspect of autism and ADHD.
Yeah. So definitely is a huge part in how inflammation can take place in our body and how, the neurotransmitters are kind of like produced and sent to the brain as well. And the autistic individual, like the research has shown that we're born with like gut dysbiosis, and that the microbiome composition in your gut is potentially more predisposes you to mental health challenges. And so with that, then you have that different gut like structure where there is a higher level of leaky gut, where I can't remember the exact definition of that now, but it's when like the food doesn't get absorbed, in the right way, and then it can kind of leak into like a system that isn't right to be there.
Intestinal hyperpermeability.
I think so.
Yeah, that's the term. No, that's what leaky gut is. But you said you couldn't remember the term, so I'm bridging a gap here.
Great, awesome, because I can't remember all the terms. And
and it's also your work is working so much in community that you adopt the language. It's like I say leaky gut all the time, but if I'm speaking at a medical conference, it's intestinal hyperpermeability. Exactly. I feel like I do a lot of code switching in that degree.
Yeah, you'd be a translator. So then there is that gut and brain connection, right? That we know is vital because it's not just one direction, as it turns out. It is bidirectional. So whatever that you're feeding your gut, will help your brain or not. And whatever you're thinking will help your gut or not. So that is a bidirectional relationship. And in the UK, I don't know what it's like here, but I have heard that it's a problem as well. It's the mycotoxin gut dysbiosis, mold toxicity, that people tend to get in the house that they live in. It's very damp and often can, cause a infection in your gut that causes difficulty in absorbing like the nutrients from the food. So you could be eating really well, but your body isn't absorbing everything that could really help it from the food that you eat. And that apparently mycotoxin gut dysbiosis can also send vapors to the brain that increases inflammation, and that in itself already causes mental health challenges. But we don't talk about hypermobility, in the autistic ADHD community, where there's like hypermobility, EDS, Ehlers-Danlos syndrome, and then the POT seems to be a trifecta of conditions that can also affect this sort of gut-brain connection. In that, so there is like when you have like hypermobile tissues that can also cause challenges, with bringing like kind of signals to the brain and thereafter. So then we're looking at a system imbalance. It's funny when you talk about dysregulation, because I've always wondered if it is good to call anything dysregulated, but that's what we deal with, right? In medicine. I prefer to see it as a system that is in flux, that is constantly striving to achieve homeostasis, but that is like far between. Yeah. So that's how I see it.
Yeah. I mean, well, that's exactly. It's in flux. I think about when people will say, oh, there's no such thing as a hormone imbalance because your hormones are always in flux. And I'm like, well, what do you call hypothyroidism? An imbalance of thyroid. It's low thyroid. What do you call insulin resistance, like these are like, hormone imbalances, and the body is no longer able to get back to that place of balance, and we need to have assistance. And I think, as you talk about dysbiosis in the gut, for people who don't know what that is, it's an imbalance of your normal flora. So things that should be there, it's not pathogenic organisms, but stuff that should be there, but it's in the wrong numbers. And if anyone's ever had a yeast vaginitis, yeast infection, then you have yeast in the vagina. It just takes an opportunity to overgrow sometimes. And in that dysbiosis, sometimes there's that dysregulation of gut health. We have to bring in things to help that system get back into that flux, like to find its homeostasis again. And sometimes it's as simple as increasing your fiber. And I love when it's just water and fiber. So love that. But other times it's like, no, actually, opportunistic organisms have overgrown. Yeah. And we know that in some studies, autistic and ADHD individuals don't have enough of the beneficial flora that they should have. So, we need lots of biodiversity in the gut. We have studies on when you're born, but then there's also the eating behaviors that can develop later that can then further contribute to the dysbiosis that we're seeing.
Yeah, the number of autistic children who love white beige food early in life, bread that feeds the growth of microorganisms that aren't healthy, but also chocolate, sugar.
Yeah. Well, who doesn't love chocolate? I mean, come on.
Yeah.
No, but it is, the beige diet for sure. And that's where, sometimes like as a mom, I totally get when it's like, it's so much. I mean, there's definitely times at a restaurant where my kid is eating French fries. Like that's what this toddler's going to eat. So he doesn't have blood sugar that crashes and then everybody's in their nightmare. But that's, also where it's like, sometimes you're going to give and sometimes you have to get creative and you have to, make a smoothie. And sometimes it has to be, this is where it gets like so aggravating. I think when you are a neurodivergent adult dealing with neurodivergent children, it's like, no, the smoothie's too thick this time. Now the smoothie's too thin this time. Like it's that, the sensory needs are always changing, but you still have to like give it your all and get creative to get them the fibers, to get them the phytonutrients.
Yeah, I definitely find it when you introduce probiotics, the right ones, like their appetites do increase. And it's like when you give them the right, kind of microbial composition, they even start to taste food differently, because the challenge with that, being born with a certain type of microbial composition is that food that tastes one way to someone may not taste the same to you. And so like in my experience anyway, like I've seen with my own child who only like beige fruit, he started eating broccoli after about starting in probiotics. And so that was really good. And they've also done research on that to show like probiotics can support, mental health.
Yeah, it's so interesting because we've even got research on very particular strains. Like it's not just Lactobacillus rhamnosus, it's the particular strain of that organism and how that can influence mental health or weight. It's funny, as you were saying, like your child then ate broccoli. I had Dr. Elisa Song on. We talked about picky eaters. She talked about zinc being a big issue. And once you get zinc in, because it changes taste receptors and how that can be so helpful. But I was like, man, all my kid will eat sometimes is broccoli and beef. Like that would be like, I just want to eat broccoli and beef. But so I'm like, I'm grateful for that. But also like my oldest is like, I'm going to eat bone marrow. And like, oh, we were just somewhere this weekend. He's like, I'm going to eat ribs and I'm going to get all this stuff. And my youngest is like, I'm not, I don't even want to look at that. And he's like, I will eat a piece of steak. I'm going to be good with that. And then I'm going to eat some cucumbers. And I'm like, I call that a win right now.
Yeah. Like I've actually known like mothers, who had kind of turned into their entire career to find out how to give their children, neurodivergent children, the right foods. And, this friend of mine, she went to seek occupational therapy. Yeah. Is that the right term?
Yeah,
I think again.
They can be phenomenal
for their children
behavior.
For also textures, like their relationship to food textures. She said after a few sessions, they completely changed. Like the child is now able to eat like lots of different food, and she also like, I don't have the time for that, but like, you know, create food out of like bone broth that has been seeping for 12 hours, and then you know, kind of putting
she was doing the
yeast in.
GAPS diet.
Potentially without knowing it, you know,
Yeah.
that she's got like lots of tips and it's like really good stuff. But you know, I don't have the time for that. I'll just have to go to the butchers. You know.
Yeah. Are there have you seen anything in the research about particular strains or anything that's been particularly helpful?
I don't remember it, but I have done research on this when I was buying probiotics for my own child. I definitely like recognize the strain that you mentioned, but no, not in detail.
Mm-hmm.
No.
So I wanted to ask you, how can a neurodivergent woman advocate for herself at work and in life without falling into the trap of feeling fear or shame or like they're being too much?
Yeah, so that's interesting because often when we're in a situation, our brain might see that as, oh, I'm in this new place. It's a liminal state of actually having been diagnosed, maybe trying to unmask, but also then how do I deal with that request or relationship that asks of me something that I can't give. And that's I love like one of the results of our AuDHD women survey is what AuDHD women want in relationships. It's just so validating because it had all the elements that are really important to us as a collective. That it wasn't just me being difficult or me being like too much. Like we all need emotional safety. We need intellectual stimulation. We need the ability to be able to like actually not be someone's caretaker came up quite top. But often without knowing all this, if something makes you feel uncomfortable, even if you cannot explain it just yet, you just say like, I'm a bit uncomfortable about this, I'm gonna have to get back to you. And that is in the context of a personal relationship, and maybe you will take some time to process that, or you get, you know, a coach or somebody to help you kind of work it out. But then in the workplace, that's where it can get a bit difficult because as women anyway, we tend to need to appear like we're functioning really well in order to go up the ranks at work. And for autistic ADHD women, this takes on a whole new level of being very functional, hyper-functioning without people knowing that maybe you're burning out left, right, and center inside. And so I talk a lot about burnout. When people have asked me to talk about resilience, how do we, you know, make ourselves more resilient to deal with the system? And then how do we advocate for ourselves? Is that I suppose there comes a point where you need to help people understand that what you're dealing with isn't just, you know, in the brain, it's biological and it's hormonal. And that's why education in the workplace is really, really helpful. But also, like being able to advocate for ourselves in the workplace. Like I would always say, bring your whole self in there. Don't shoot yourself in the foot and focus only on the bad. And you need to bring your strengths to it as well. But you say, in order for me to do my best work, I need this adjustment. And sometimes you don't even need to expose, you know, or open up as autistic or ADHD, but it certainly helps if you do, because then the law is supposed to be on your side. Although it's a bit of a gray area there in terms of whether companies are inclusive. So yeah. I hope that answers the questions.
Yeah. No, well, thank you so much. This has been such a wonderful conversation. I could literally talk to you for hours.
Yeah, I feel like we can talk. And it's really nice to be able to talk to you on a level that, like, I know you know what I'm talking about. So thank you. Thank you for this opportunity.
Yeah. Thank you so much for joining the conversation. If you could like, subscribe, or leave a review, it helps me so much in getting this information out to everyone who needs it. If you enjoyed this conversation, then I definitely want you to check out this.